Di nagtatapos sa 4 na sulok ng kwartong ito ang kwentong top rank. Mag-aaral, magsasaya, at higit sa lahat, magtatap sa board exam. Dahil sa top rank, pamilya kami.
So always remember, ang dami niyong opportunities, okay? What we offer in Asian is, you tell us what to do, and we will make it happen for you.
Don't ever let somebody tell you that you can't do something. Not even me. You gotta dream, you gotta protect it. You want something, go get it. Here.
Be confident. You have that knowledge. Later on, ang tanging hihilingin mo na lang ay enlightenment.
Hey! Rankers, congratulations. Kino-congratulate ko na kayo lahat kasi alam ko mapapasa niyo lahat yan dyan sa board exam na yan. And not only just pass it, but really with flying colors.
Hi, we're the ones, and we're wishing you good luck sa inyong exam. Alam kong lahat ng hard work nyo ay magpe-pay off at sana lahat ng nilibid nyo ay maalala nyo. At ngayon pa lang, kino-congratulate na namin kayo. Congratulations dahil alam ko na kayo ay papasa at mapapabilang kayo sa mga top notchers this year. So congratulations in advance, top rank RNs.
Our first runners-up. The world is full of successful failures. Many of the most successful people overcome setbacks and disappointments to reach the top. Be the tenacious and the old-fashioned alchemist who turned metal into gold. Success is a state of mind. Always tell yourself, I can get through this. I will get through this. I must get through this. Saturday is your big day. Don't lose your chance. Live that day as if it were your last day. Your time is limited. Do not waste it living someone else's life. Know what you want in life. Define your own success and stop at nothing to achieve it. Don't ever let somebody tell you that you can do something. Not even me. You got a dream, you got to protect it. You want something, go get it. Period. What is your goal, class?
Of different schools we start, with a single name in our part. The clash of battle is sweet to hear. Right now when the victory is near, excellence is our only standard. shine the rest with a great mind and compassionate heart. A home that trained us to be the best we can be. All that we learned at Top Prof Review Academy. We shout with pride and heads up high as victors our dreams shall soar to the sky. The trained us to be the best we can be. Soar to the sky. We learn that Top Prof Review Academy. Soar to the sky.
Dear Lord, we thank you for the gift of life today. You allow us to have another day to praise you and see your glory. Thank you for the love and protection, especially this time of pandemic. Bless us, Father, with your wisdom as we begin our class. Help us to focus our hearts and minds on what we are about to learn. Inspire us by your Holy Spirit as we think and listen. Guide us by your eternal light as we discover more about the world around us. Lord, we thank you and let your will be done in our lives. We ask all this in the mighty name of Jesus. Amen.
Everest is only a mountain. A pyramid is just a shape. Doesn't have to hold you back, doesn't have to pin you down. Let your dreams take flight in your heart. Ignite. Did you know that it's true? Everything is possible. There's nothing we can't do. It's a wild and beautiful fire, and I believe in you. I believe in you. out and shout and follow the stars. Forget about the past, it's over. We are the young ones, our way is forward. Who keeps tabs on stupid mistakes? We all mess up, but that's just the way. We learn how to get back up. We learn how to turn the page. So we will let our dreams take flight and our hearts ignite. Did you know that it's true? Everything is possible. There's nothing we can't do. It's a wild and beautiful fire, and I believe in you. Let your dreams take flight in your heart ignite. Did you know that it's true? That everything is possible. There's nothing we can't do. It's a wild and beautiful fire, and I believe in you. Oh, I believe in
I can almost see it, that dream I'm dreaming, but there's a voice inside my head saying you'll never reach it. Every step I'm taking, every move I make feels lost with no direction. My faith is shaken, but I gotta keep trying. Gotta keep my head held high. There's always gonna be another mountain. I'm always gonna wanna make it move. Always gonna be an uphill battle. Sometimes I'm gonna have to lose. It ain't about how fast I get there. Ain't about what's waiting on the other side. It's the climb. The struggles I'm facing, the chances I'm taking, sometimes might knock me down, but no, I'm not breaking. I may not know it, but these are the moments that I'm gonna remember most. Yeah, just gotta keep going, and I gotta be strong. Just keep pushing on, 'cause there's always gonna be another mountain. I'm always gonna wanna make it move. Always gonna be an uphill battle, and sometimes I'm gonna have to
precious thought that steals my breath. It's a heavy weight upon my chest as I lie awake and wonder what the future will hold. Help me to remember that you're in control. You're my courage when I worry in the dead of night. You're my strength 'cause I'm not strong enough to win this fight. You are greater than the battle raging in my mind. I will trust you, Lord. I will fear no more. I will lift my eyes, I will lift my cares, lay them in your hands, I'll leave them there. When the wind and waves are coming, you shelter me. Even though I'm in the storm is not in me. You're my courage when I worry in the dead of night. You're my strength 'cause I'm not strong enough to win this fight. You are greater than the battle raging in my mind. I will trust you, Lord. I will fear no more. I will fear no more. I will fear no No power can come against me. You have overcome. No darkness can overwhelm me. 'Cause you've already won. No power can come against me. 'Cause you have overcome. No darkness can overwhelm me. 'Cause you've already won. You're my courage when I worry at night. You're my strength 'cause I'm not strong enough to win this fight. You are greater than the battle raging in my mind. I will trust you, Lord. I will fear no more. I will fear no more. I will fear no more.
close my eyes and I can see a world that's waiting up for me that I call my own. Through the dark, through the door, through where no one's been before, but it feels like home. They can say it all sounds crazy. They can say I've lost my mind. I don't care, so call me crazy. We can live in a world that we design. 'Cause every night I lie in bed, the brightest colors fill my head. A million dreams are keeping me awake. I think of what the world could be, a vision of the one I see. A million dreams is all it's gonna take. Oh, a million dreams for the world we're gonna make. There's a house we can build. Every room inside is filled with things from far away. Special things I compile, each one there to make you smile on a rainy day. They can say it all sounds crazy. They can say we've lost our minds. I don't care if they call us crazy. Run away to a world that we design.
Every night I lie in bed, the brightest colors fill my head. A million dreams keeping me awake. I think of what the world could be, a vision of the one I see. A million dreams is all it's gonna take. Oh, a million dreams for the world we're gonna make.
However big, however small, let me be part of it all. Share your dreams with me. You may be right, you may be wrong, but say that you'll bring me along to the world you see, to the world I close my eyes to see. I close my eyes to see.
Every night I lie in bed, the brightest colors fill my head.
A million dreams are keeping me
A
awake.
million dreams, a million dreams. I think of what the world could be, a vision of the one I see. A million dreams is all it's gonna take. A million dreams for the world we're gonna make.
For the world we're gonna make.
Good morning po, ma'am.
Hi, good morning. I'm sorry, I was having difficulty looking for the link. Good morning, everyone. Who is with me today, Sir Ron?
Yes po, ma'am. Sir Ron po.
Okay, have you prayed already, anak?
Yes po, ma'am. Tapos na po.
How many do we have? 5:33?
Yes po, ma'am. Yung iba po, papasok pa lang.
Yeah. Let's give them few minutes. Anyway, it's my fault, late din ako ng few minutes. Because I was looking for the link, nawawala. Good morning. Oh, so nice to see a lot of good morning messages. Makes me happy. Cavite. All over the Philippines. Hello, world. How do you put that? Is that a bear or dog which moves? Some of you are doing that. I am Ingit Match. How do I make that? Teki teki. Anong fesla? Oy, thank you din for being pretty din. You are all pretty. UPHS. Yeah, I have to look good and fresh for you to be inspired. Kasi it's a mortal sin naman if the teacher looks pangit, di ba? Thank you for the affirmation. It enhances my morale. Yeah, good morning with a heart. Yung daughter. Hello, little girl. Yes. Always remember the possibilities. Okay, let's get going na. So that you could hone your best and ace the Philippine Nursing Licensure Exam. Okay, let me share my windows. Sir Ron, am I sharing the screen already?
Yes po, ma'am.
Okay. So, happy morning, everyone. God is good. It's another wonderful and blessed day for all of us. Thanks, God, it's Friday. And thank you for allowing me to change the schedule instead of Wednesday, I think, is that Wednesday? Okay, we made it as Friday because I had a very important matter to attend to on that day, and I know I have all your support, but your sacrifice paid off. Well, I have just defended my dissertation last Wednesday in doctorate in nursing management, and I did well. That is actually my second doctorate degree. But, you know, doctorate degrees will not matter unless you really serve the stakeholders with all your heart. So that is still my apostolate, to help thousands or even millions of nurses ace a very crucial examination, which is the licensure exam wherever the country you may be. Okay, so let's get going. So I hope you have your materials with you. Okay, now let's get going. Word of wisdom. The stronger factor for success is self-esteem. Believing you can do it, believing you deserve it, believing you will get it. Get your license get your RN license in the Philippines. Grab it from the air. Come on, grab it and put it in your heart. Sa tapat ng puso mo. Okay? Did you grab your license already? Okay, that's very good. So, let's get going. And another food for thought for today, as you have asked. Success is the sum of small efforts repeated day in and day out. And you know what? When I have to defend a dissertation, I do my PowerPoint, I do my manuscript, rehearse until I get the correct timing. So that's what you're going to do as well. Practice test, practice test, practice test until your performance is fluid. Okay? Are you ready for success? If so, here we go. The situation is about care of patients with cancer. You know that the #1 killer of people in the Philippines is still cardiovascular, and the second is cancer. Okay? That is very devastating. So, in #1 question, the issue is about oncovine. Concept to remember. The most common side effect of oncovine or vincristine is constipation. It's constipation. So with that concept, you can answer the question correctly, which is adequate fluids. Remember that the most effective nurse intervention to prevent and relieve constipation is lots of fluids. But of course, it depends on the condition of the patient. But the situation didn't say that the patient has renal problem. So we could answer letter D, dagupan. How many got the correct answer? Yay! I think 100% got the correct answer. If you didn't get it, now you know. That's what matters. Okay? Now let's have #2. Wait lang ha. Ibaba natin ito. Okay. So, unsealed source of radiation therapy. You know that unsealed source of radiation therapy is given either orally or per IV. It's orally or per IV. It is a form of internal radiation therapy. And remember the principles of radiation precaution, DTS, distance, time, shielding. Now, limit time with the client for 30 minutes per shift. That's a correct answer. So let's look into the choices. Yung walang number 1, crash. So crash, letter C. That is how you save time, ha? The strategies. Keep tongs forceps in the client's room. Oy, binibigyan ka ng beta blocker. Miniminotoprolol ka. Because, as I've told you, it's taken orally or per IV. So there's nothing that will fall, okay? So anything with number 2, out na yan. All of the above, may number 2, crash. Letter B, may number 2, crash. So you see, you save time. Now, of course, the highlighted answer is letter D, dagupan. But don't be a trigger happy, huh? You have to check if that is the perfect combination. Use gloves when handling body secretions. Well, that is a standard precaution actually. Using disposable eating utensils, yes, because if it is unsealed source of radiation therapy, then the radiation is systemically absorbed. Therefore, body secretions and excretions are radiation contaminated. It could be tears, it could be sweat, it could be saliva, it could be urine, it could be feces, and even semen, okay? And vaginal secretions. So, number 5 is correct. True statement. Wearing lead shield. That is the letter S in the DTS. So, number 6. Perfect combination. It's letter D, Dallas. How many got the correct answer? Wow, bright future towards RN licensure. Some of you will land in the top 10. Wag naman lahat kayo. Baka pagka-problem tayo sa top rank, kung lahat kayo nasa top 10, mag-usap na lang kayo. Sinong nasa top 1 to 10 at sino ang nasa 11 to 20 and then the rest. O, ganun lang yun anak. Bigayan tayo. Kanya-kanyang moment yan. Okay? So, let's have number 3. This time, again ha, male ang patient. Cancer of lung stage 2. O, characteristics of malignant. Malignant. Number 1, yes. Number 2, yes. Number 3, no. Remember, initially, cancer is painless. Yun yung term na hanapin nyo. Kaya nga, painless or non-tender tumor, mass in the breast, painless hematuria, painless enlarged lymph nodes, usually painless. Okay? Number 4, yeah, metastasis. Number 5, yes. And number 6, no. Even after surgery, there is high probability of recurrence. That's why the patient needs to have lifelong follow-up check-up. Kaya best answer, letter A. Teka, ano bang lugar ang letter A? Sa Cagayan, merong Alagao, Aritao. Yan. Okay, let's have number 4. It's a long situation. What did I tell you? Go to the last statement because that is the question. The nurse teaches a group of women in the community who want to perform BSE that the technique will involve which of the following? Select all that apply. Okay, number 1, yes, palpation. Okay, and then number 2, so palpation inspection rather. Number 2, that's cruel, no hard squeezing. Ay, grabe na yan. It should be gentle. You know that the required term for in nursing is gentle. Wag namang hard squeezing. That is ouchy naman. Number 3, yes. Number 4, yes. Why? Folded towel under the shoulders so that the breast tissues will adequately be palpated. Number 5, yes. And number 6, yes. So the only one that you will not check is hard squeezing. So the answer would be 1, 3, 4, 5, and 6. What letter is that? You have to help me. Anong letter yun, anak? Hindi ko makita dito eh. So basta, nasa chat box ba kayo? Okay, I'll turn on the chat box para may kausap ako. Ha? Ayun. 1, 3, 4, 5, and 6. Letter D. Yes. It's letter D. Hirap naman. Mayroon pa kasi akong pa-laser. All right. Now, let's go to number 5. MRM for stage 2 breast cancer. Appropriate nurse interventions. A strategy that I told you, I shared with you. Appropriate positive stem. So the true statements are the correct answers. The true statements are the correct answers. Teka nga, ayusin ko lang to. Bakit may lumilitaw dito na isa pang plate? Wait lang ha. Parang may hurdles ako sa technology this morning. Okay, I'll just fix it later. Now, place the patient in semi-Fowler's position. Yes. Why semi-Fowler's? To enhance lung expansion and prevent potential complications like atelectasis as well as hypostatic pneumonia. Why arm on the affected side abducted and elevated? Sometimes they call it as a Statue of Liberty position. This is to promote venous drainage and prevent lymph edema. Monitor hemovac output. Yeah, it is zero sanguinous. It is pinkish but not viscous. Because if the drainage is reddish and viscous, that is active bleeding. Check the back of the patient for bleeding. That's a true statement because, you know, the very thick pressure dressing over the operated site will not be soaked by gravity, by gravity, blood flows to the back. Number 4, regular coughing and deep breathing exercises. Yes, true statement. Again, the rationale is to prevent respiratory complications. Keep the arm on affected side immobile for 24 hours. That's not good. It's a false statement. In fact, as soon as the patient is awake, we ask the patient to do pronation, supination exercises of the hands and squeezing rubber balls. This will help promote venous return, prevent lymph edema, and prevent stiffness of the arm. And then, kino-cover naman nito yung aking presentation. Wait lang ha. Bakit may umapir dito na lower? Wait lang ha. Sorry guys, may uma-appear doon sa aking, kino-cover niya yung aking presentation. I'll just fix it later on. Then, post signs warning against taking blood pressure, starting IV infusions, or drawing blood from arm on the affected side. Why? Trauma may cause infection and also lymph edema. And that will not be good because if the patient develops lymph edema, that arm on the operated side will be very huge. Not having a breast is bad enough. So, It's 1, 2, 3, 4, and 6. It's letter B. This time it is Baguio. Yes. Okay, let's have number 6. Oh, but anyway, I'll show you a picture. This is Himovec. And this is JP or Jackson Pratt. The purpose of this wound suction drainage is to drain exudates from the operated site. Because exudates will compress nerve endings, there will be pain. Exudates compress blood vessels in the area, there will be impaired circulation. Okay? Now, postoperatively, to prevent lymphedema, in general, the concept is prevent trauma. Prevent trauma. Okay? Letter A is a false statement. Arm flexed may cause edema. Exposing the arm to sunlight to increase circulation, no sun exposure. Okay? Wrapping the arm with elastic bandages during the night, not also helpful. So it's more on avoiding unnecessary trauma like injections, drawing blood, starting IV fluids, blood transfusions, working with thorny plants, and so on. Okay? Now let's have number 7. Well, by the way, so far, how many correct answers do you have? So this is lymphedema after mastectomy. That's why we usually advise the patient to have a medic alert bracelet. Nakalagay dyan, may nabibili yan sa mga Mercury, kahit anong pharmacy, may mga nabibili yan. Okay? Nakalagay doon, caution lymphedema. Or we tell the patient that it's time that she will deal with a doctor or a nurse or other healthcare workers. Let them know that BP will be taken on the left arm. Educating the patient will ensure that she is participant in her care. Kasi nasa chart man ko minsan na caution, right arm precaution, nakakalimutan niya ng nurses, doctors, and other healthcare workers because we have so many patients to care for. But if the patient is given health teaching, let them know. Ganyan. Kunwari, let them know you have latex allergy. Let them know that BP will be taken on the left arm. And that's very effective, I tell you. Okay? And you know, lymphedema is a type of edema that will never subside. Kaya the best is prevention. Can you imagine you have no breast on this side and then you have a very huge arm on this side? So, you know, body image matters. Diba? Body image matters. Okay. Next, number 7. Arm exercises to prevent lymphedema. Itong letter A, make upward spider-like movement of fingers on the wall is actually the rewarding of wall climbing. Hindi ikaw mag-i-Spider-Man, pero yung fingers mo make spider-like movement on the wall. Okay? Ngayon, of course, initially, may pain yan. Kahit may pain medication, may pain talaga. Kahit naka-oxycodone yan. Kaya, whatever level the patient reaches today, lagyan mo yan ng mark. Lagyan mo ng mark. Para feedback yan, tomorrow, itataas niya yan. Wow, you're doing great. Mas mataas tayo ngayon hanggang sa yung maximum height. Kaya pwedeng facing the wall or side to the wall. I told you, rewarding is the name of the game in PNLE. Kaya yung wall climbing ay upward, spider-like movement of fingers on the wall. Pwede pa para masaya yung pasyente. Initially, while you are teaching her. E di kantahan mo ng Incy Wincy Spider went up the water spout. Oh, di ba? Did you sing that as children? Oh, yung mga may children dyan, you could teach them. Di ba may ano yan sa video, sa YouTube, Incy Wincy Spider went up the water spout. Then came the rain, blah, blah, blah. Ganon. Okay. Now, let's have the next situation. Tapos na tayo sa sample questions of cancer. Punta tayo sa neurologic disorders. Wow. An equally interesting topic. Amyotrophic lateral sclerosis, ALS. Do you remember yung ice water bucket challenge nung araw? Kasi yun yung nararamdaman ng pasyente na may ALS. Okay, it is an upper motor neuron disorder. Basta motor neuron disorder, remember, muscles are affected. Basta muscles yan affected. Muscle weakness, yes. Intention tremors, if you remember in our discussions, that is multiple sclerosis, which is different from ALS. So, out siya. Muscle uli ito. Number 3, yes. Muscle uli ito, yes. Shuffling gait is a characteristic manifestation of Parkinson's disease. You see, the MS drills that we had last time will see you through in your PNLE. As is, parang saan ba to? Now you know. We are applying it, di ba anak? Okay. Respiratory difficulty, yes. Because even the respiratory muscles become weak or even paralyzed. So best answer, letter A, alabang. 1, 3, 4, and 6. Okay. Ilan ang score mo out of 8? Natutuwa ka ba? Ngayon, if you have a mistake, then don't despair. At least before your exam, now you know. That's what matters. Nahabol natin, anak. All right, let's get going na. Let's have number 9, hemorrhagic CVA. Ano ang position? Extension and internal rotation of the arms and wrists. Obvious ka. Pag extension, edi decerebration. Letter B, bagyo. Let me check the picture. Okay. If the, you know what? Sa decortication and decerebration, the legs are both extended. The difference would be on the posturing of the arms. Pag yan ay flexed, that is decortication. So sa decortication, what is the problem? Cerebral cortex, decortication is damaged. Pero pag yan ay extended na, that is brainstem damage. Ano ang implication ng brainstem damage? Anytime. The patient may go into cardiopulmonary arrest. Cardiopulmonary arrest. Okay? Kaya delikado pag yan extension na, nakaunat na. Kasi brainstem damage na yan. Okay? Poor prognosis ka. Alright. Number 10, basta increase ICP to reduce the ICP by draining CSF from the subarachnoid space of the brain to the subarachnoid space of the spinal cord by gravity. Ito yon. Head of bed elevation 30 degrees. Ideally, 15 to 30 degrees. The best is average of 30 degrees, max of 45 degrees. Caution, never elevate head of bed of patient with increased ICP at 90-degree angle. Why is that so? Why is that so? Because elevating the head too high at 90-degree angle may cause brain herniation. That's devastating. Brain herniation, compression of the brainstem, where the patient has the centers that control the heart and the respiratory functions. Kaya the patient may go into cardiopulmonary arrest. Okay? So the best is still a slight elevation of the HOB or head of bed. Does that make sense, nurses? I hope it does. Okay, so this is the elevation of head of bed. 30 to 45 degree angle, never at 90-degree angle. Okay? Of course, proper positioning to prevent contracture deformities, just like foot drop. Yon. Tic douloureux. What cranial nerve is affected? Trigeminal. You know that tic douloureux is characterized by severe pain on the side of the face. Okay? So it's also called trigeminal neuralgia. You know what? If a patient has tic douloureux or trigeminal neuralgia, the pain is very severe. That there were studies which showed that people experiencing trigeminal neuralgia may even experience depression and attempt suicide. So can you just imagine the severity of pain for a person to think about committing suicide? Para bang sobrang sakit na ito, hindi ko na kaya, I need to rest na. O wag mo nang magdrama-drama, ha? Sobrang hirap na itong preparation for PNLE. Kayanin mo, anak. Kung si Ma'am Udan nga ha? Nag-second pa ng doctorate at the age of 65 pa. Edi puyat, pagkain wala sa oras, kasama yun. Kasi pag nasa statistical analysis ka, hindi mo pwedeng tayuan yun, di ba? Kaya I am sharing this experience with you to inspire you. Ang babata pa ninyo, kaya nyo yan. Ako nga nakaya ko pa And magpahinga lang ako konti, baka mag-aral ulit ako. Ma'am, ba't ka ba nag-iipon? Sabi ko kasi kay God, when I face God, I can tell God, I have used all the talents that you have given me and there's nothing more that I can offer you. Di ba? Matutuwa si God nun. Sige, pasok ka na. Di ba? Ayan, ganyan kasakit si trigeminal neuralgia. Well, how do they manage it? Pwedeng steroid. Tapos pwede rin yung mga anti-seizure na medication. They have analgesic effect kagaya ng Tegretol. Ngayon, pag hindi kaya ng medication, di surgery, neurectomy. They will cut off the trigeminal nerve. Wala nang pakiramdam ang face mo, 'di ba? You know, even the touch of the wind on your face, even the touch of water when the patient washes the face, when chewing, when taking something hot or cold, kunwari kakain ka ng ice cream, nako, grabe ang pain niyan. Okay? So, yan yun. Cranial nerve 5, trigeminal neuralgia. Thanks to technology. Alam niyo, tuwang-tuwa ako sa technology kasi it's a lot easier to explain. Ang hirap kasi yung puro lang words, lecture lang, hindi innovative ang teaching method, di ba? Okay. Well, actually, kailan ba ako nag-start ng hybrid teaching? Sa US, 2009. Because most of our students were working. Alam niyo naman sa Amerika, once you're 18, out you go from the house of your parents and you have to support yourselves. Kaya nga, ang ganda-ganda ng culture natin. Kayo, more above 18 years old. Yung iba sa inyo, siguro may 50s pa, married pa. Pero supported pa rin ng parents. O, di ba? Ang bait ng Filipino parents. Sige na. Number 12 na. GBS, highest priority. You know that GBS is characterized by ascending paralysis. Okay? So, the paralysis starts from the toes. Every day, umaakyat yan until even the respiratory muscles are paralyzed and up to the facial muscles. Ngayon, well, priority, respiratory problems, ABC, airway, breathing will be priority. Yun. It's letter C. Okay, Cagayan. Let's have number 13. Abducens. Alam na this. It controls the lateral rectus muscles of the eyes that will turn the eyes from side to side. What I usually tell nursing graduates is that just remember, it may be the cranial nerves that people are using during the exam. Kung may storytelling related, then, well, it could be remembered. Turning the eyes to different directions or rewording from right to left. Yan yon. Abducens. Letter C, Cagayan uli. Let's have number 14. CT scan with dye injection. Okay. What do we tell the patient? Basta contrast medium, usually they are iodinated, kaya may cause warm, flashing sensation. Why is it important to tell the patient that? So that they know what is expected and we will prevent unnecessary anxiety. Alam nyo, pag alam ng patient ang pwedeng expect, they're less anxious. Is it important to be less anxious? Yes. Alam nyo, may mga pasyente na wala namang cardiac problem. But when they're facing a challenge in their health or maybe undergoing an unfamiliar diagnostic test, bigla naming makikita sa monitor, aba, nag-AFib. Hindi naman sustained, pero talaga may atrial fibrillation. After the test, clear naman, walang trace ng atrial fibrillation. That's how anxiety affects us. Kaya huwag niyong hahayaan na yung BP ninyo tumataas while preparing for PNLA. Ganito. So that, well, anxiety is normal. Pero wag naman yung high level. Mild anxiety will, motivate learners. Okay lang naman yun. Konting anxiety. Ha? Kasi kung masyado ka ring lax, edi natulog ka lang ng natulog. Yes? Kaya yung mild degree of anxiety, okay lang yon. If you know what to expect, then less anxious ka. And you will feel more comfortable. Okay? So, it's letter B. Baguio uli. Hindi siya 2 hours. Kung minsan, mga 20 minutes. Oo. Okay. Now, Alzheimer's disease. Ayan, nagnanavigate tayo ng different topics sa neurologic disorders. In Alzheimer's disease, it's a type of dementia which is characterized by intellectual deterioration, di ba? At saka specifically, loss of memory. Yon. Kaya, the best nursing intervention provide for an environment with less decision making. Paano yun, ma'am? Less decision making. Kunwari, you ask the patient, what would you like to take your medication with? Orange juice or water? Dalawang choice lang. Huwag mo nang enumerate lahat na orange juice, kiwi juice, apple juice, juice kuday. Ang daming choices. Dalawa lang. ito, letter A is a false statement. Unstructured environment, ibig sabihin nun, very flexible, walang definite schedule. For a patient with Alzheimer's, it should be structured. May definite schedule. Kunwari, 6 to 8 a.m., breakfast. Ganon. O kaya, 9 a.m., taking a shower. O 10 a.m., taking a.m. snack. 12 to 1, having lunch. Ganon ng ganon, araw-araw, ganon ng ganon ng ganon ng ganon. Structured. That will, prevent unnecessary confusion. So yung unstructured at flexible, pareho. What did I tell you? When two or more choices are similar, they are distractors. Have you been applying the strategies that I shared with you? Kailangan na. Although initially parang, ano ba yung strategy ang gagamitin ko dito? Now, I'm giving you models, matatanda nyo na anak. Ay, o nga pala no. Stimulating environment, di nagkagulo yan. Do you get me? Kalma-kalma lang dapat ang environment ng patients with Alzheimer's. Alam nyo, sa Amerika, ang dami-daming may Alzheimer's. Kaya nga, maraming nagpuput up ng nursing facility o nursing homes ng alaga nila, patients with Alzheimer's. And then, noticeably, even in the Philippines, nagkakaroon na rin ng Alzheimer's. Noong araw kasi, ang sabi lang natin, ano na ang Tagalog noon? Nag-uulyanin. Yun, na para ba accepted na, matanda na kasi ulyanin na. Pero, later on, it was also diagnosed na ang Alzheimer's dito sa Philippines. And you know what, guys? Research had evidenced that one of the best measures to prevent Alzheimer's, read every day. Kahit one page of a book lang, kahit front page lang ng newspaper, o kaya pag nag-travel ka at hindi ka naman nag-drive, basahin mo lahat yung mga billboards sa mga tindahan, di ba? Matatawa ka kung minsan kung ano-ano may mga kung nilalagay sa Facebook kung minsan, may mga billboards na nakakatawa yung mga pangalan ng mga stores, etc. Pati wrong grammar. Yan. Okay? Stimulating environment, no way for a patient with Alzheimer's. Number 16 tayo. Inability to move. Kinesia. A. Whenever the prefix is awan. Wala. Okay? Si Ma'am Udan kasi, half Ilocano, half Kapampangan. Kaya yung napansin ko na magkaaway palagi sa dorm ng mga lahi, yun ang lahi ko. Kaya wala akong kaaway kasi kakampi ko yung mga Ilocano, kakampi ko yung mga Kapampangan. Kaya gusto nila akong friend. Kaya kung may food na dumating from the province for Ilocano, ako doon, join ako doon. Kung may food galing sa mga probinsya ng Kapampangan, like Pampanga, from where my father is, join ako doon. Ayun, naging chaber kasi lahat kinakainan, no? Ay, nag-share din ako. Pag galing sa Zambales, dami naming mangga, share ko sa kanila. Dami naming kaimito, share ko sa kanila. Di ba? Ganun lang yon. Pero pag Brady, slow movement yan. Pero pag kinesia, no movement. Kunwari yung akinesia. But of course, I'm just giving it an example. Don't do it, ha? Don't be naughty. Put the patient in Statue of Liberty position. You go back to that position, to that patient after an hour, ganun pa rin ang position niya, Statue of Liberty. Yon. Okay? Hindi yan statue, Statue of Liberty. Yan. Alam nyo, sa States, ang daming kinorek sa akin na pronunciation. Kailan ako nag-start pumunta doon? 8:21, tapos intermittent, pabalik-balik sa Philippines. Diyos ko, Day, lahat na lang i-correct. Sabi ko, oh, Nancy, come over. I'm going to give you the endorsement. Sa kanila, mali yung endorsement. Ang endorsement daw, nag-i-endorse ka ba ng sabon? Nag-i-endorse ka ba ng sanitary napkin? Ganun. Kailan pala? Shift report. Okay. Shift report. Minsan pa, yung aking charge nurse, syempre bago ako, pa-impress ka din kahit papano para gusto ka nila sa work. Sabi sa akin, hey Josie girl, will you get the gurney for me? Gurney? Diyos ko, Day, nawindang yung brain ko. Sabi ko, what is a gurney? Sabi sa akin, oh, you came from a reputable school from the Philippines. I know that school. And you don't know what gurney is? Sabi ng tatay ko, huwag kang matatakot na magrason, pero do it tactfully and be respectful. Kaya sabi ko, Nancy, is there another term for gurney? Sabi niya, another term. I don't know. Oh, come girl, I'll show you. Dinala niya ako. Point niya, this is a gurney. Sabi niya. Sabi ko, stretcher. Sabi ko, stretcher? Yeah, because you know what? We use US books. And it's not stated that that is a gurney. It is a stretcher. See? I know stretcher, but you don't know what stretcher is. You know gurney. And I don't know what a gurney is. Quits. Sabi, ata girl, gusto ka pala nila. Kung hindi kayong parang nagmukha kang stupid, umiyak ka na. Kung pinagmumukha kang stupid, bumuelta ka in a subtle way na stupid din sila. Pero don't use the term stupid. Di ba? Simple lang, magugustuhan ka nila pag medyo funny ka. Ako by nature kasi, lumaki ako na masaya ang childhood ko. Kaya kahit ang papahiya na ako, pwede ko pa rin pagtawanan sarili ko. Ganun lang yun, anak, wag pikon-pikon. Di ba? Kahit na nasa 6th decade na ang edad, mukhang fetus ka pa rin. Ay, mukhang fetus. Anyway, sa kinis, no? Mukhang fetus ka pa rin. Ganun lang. Kaya, huwag kayong nagbo-burden, huwag kayong nagbo-burn out sa preparation ng PNLE. Masaya ang maging RN. Marami tayong hirap, marami tayong sacrifices, pero at the end of the day, we are blessed. We are blessed pa rin. And it depends on how you view your situation or life. Yan ang situation. Di mahalin mo, embrace it. Kung ayaw mo yung situation, change it. Di ba? Magsumikap ka. Yon. Alam nyo na ha, pag sinabi ni Ma'am Udan, pag ang prefix, awan, wala. Yon. Okay. Let's get going. 17 na. Cogentin. Ito na yung sinasabi ko sa inyo. Do you remember the concepts of SNS and PNS? Alam ninyo na pag Parkinson's, ang gamot ay anticholinergic. Pag tatagpo-takpuin nyo yung mga concepts, di anticholinergic yan. At sinabi pa ni Ma'am Udan, pag anticholinergic, ang effects at side effects ay SNS, sympathetic nervous system. Ano na nga yung Udan concept? Everything is high and fast, but GI and GU are slow. Yun yung ibig sabihin ng except GU. Gawin na ninyong obvious para hindi ka na mag-isip ng except pa, double interpretation pa. Everything is high and fast, but GI and GU is low. Yon. Ganun kasi ang life philosophy ni Ma'am Udan. Kung pwede mo namang simplihan, ay bakit mo gagawing complicated? Madali lang akong kausap. Ito o ito. That's it. Wala nang kung ano-ano pang rationale na yan. Simple rationale, direct to the point. So, everything is high and fast, but GI and G are slow. Constipation is slow GI, correct. Dryness of mouth is slow GI. Yes. Lacrimation, no. Kasi, ano yan? It's more on increased production of tears. PNS yan. Urinary frequency, no. GU is slow nga eh. Restlessness, yes. High and fast. Blurring of vision, yes. Because of dilatation of pupil. So, di nakuha mo, did you ever have to sit down and memorize the side effects of cogentin? That's difficult. Para sa akin, it may take a lifetime for me to memorize all the side effects of medications. Napaka-imposible noon. Hindi kaya ng powers ko. Kaya gawa ng paraan. Teka nga, mag-design ng concept. Sabi ni Ma'am Udan, di ba pag Parkinson's, ang gamot anticholinergic? Pag siya ay myasthenia gravis, di ba cholinergic? The situation itself will point out to you, ano ba yung gamot na yon? Tapos pumunta ka na kay Udan concept. SNS ito. So everything is high and fast, but GI and GU are slow. Boom! In less than 1 minute, you were able to answer a seemingly difficult question. Pag top ranker, hindi na yan difficult kasi may Udan concepts. Di ba anak? Yun. Na-lecturean kayo ng equally brilliant lecturers. Si Ma'am Udan, synthesize niya. Paano hindi ka ba naman mag-top 10? Di ba? Or pass the PNLE. Number 18 na tayo anak. Myasthenia gravis this time. Nursing measures, adequate ventilation, yes. Kasi may respiratory muscle weakness. Cholinergic on time, yes. Delay of the medication may trigger respiratory stress. Ay nako, you believe me. Meron kaming pasyente noon, ayaw niyang mag-take ng gamot kaagad. Kasi nanonood siya sa Netflix. Sinabi na namin, we could not delay your medication. Ay nako, ano siya, masungit. Sige na nga, grouchy. But anyway, I told the nurse, don't leave him. Basta, hintayin mo. Ay nako, after few minutes lang, mga 5 minutes, ayun na, nag-umpisa na siyang mag-respiratory distress. So from that time on, naging compliant siya because he experienced the effects of his non-compliance. 5 minutes lang talaga. Kaya nga may alarm clock ka at the bedside kasi you could not delay. Hindi talaga pwedeng i-delay yan. Okay? Start meal with hot soup of beverage. False. When a person has difficulty in swallowing, to help contract the esophagus and facilitate swallowing, start the meal with cold beverage. Painumin mo ng cold beverage, ganoon. Kasi kung warm, it will relax the muscles of the throat. Ma-aspirate yan. Number 4, yes, 20 to 30 minutes before eating para it will take effect and it will prevent aspiration or choking. Cover its eye alternately for strabismus, yes, so that the eyes will compensate alternately kasi nagdo-double vision sila kaya one eye at a time. Provide liquid foods if with difficulty of swallowing. No, kailangan thickened liquid. Yang liquid food, kunwari broth, sabaw, that can easily be aspirated. Pag thickened liquid foods, pwede. Kagaya ng vanilla pudding, o kaya mashed potato. Mamudan, thickened liquid ba yung mashed potato? Oo, may nabibili na potato powder. Lagyan mo lang yan ng hot water, i-mix mo, para siyang may mashed potato. Liquid pa rin yon. Oo, Mamudan sa Amerika, hindi. Nakikita ko sa groceries dito sa Philippines, meron na rin kasi, you know what? Manufacturers also study sino ba yung mga stakeholders ng kanilang products. Nakita nila yung yung population, elderly population ng Philippines, just like the entire world, talagang dumadami yung percentage ng old people, 60 years old and above. O, di ba? Kaya, alam nyo, tumatanda na ngayon ang mga tao because of better and more accessible healthcare. Dati, nasa 40s ka pa lang, patay ka na. Ngayon, ay nako, I tell you, talagang hanggang 104, 105, buhay pa. Sila na nga yung napapagod na mabuhay eh. I can't imagine myself, 104, parang ang tagal, no? Well, I'm not questioning the wisdom of God. Kaya lang, 104, parang pagod ka na noon. O, sige, ha? O, may nabibili na mga vanilla pudding, yung mga nasa small cups. Meron nabibili niyan sa grocery. Iba-iba pa nga ang nila. Hindi lang vanilla ang kanilang flavor eh. May pandan flavor, may basta mga jelly na yon, ha? So 1, 2, 4, and 5. Yes. Okay. Oh, ito yung primary features of myasthenia gravis. Alam nyo, the first sign that you will observe the muscle weakness ay yung drooping of eyelid. Ano lang, unilateral. Can you imagine biglang nag-drop yung isang eyelid niya? Yan. And then, lahat na ng muscle sa katawan, magiging weak na siya. See? Kaya, tuwing umaga, pagising mo, pagkasalamin mo, no? Tingnan mo yung eyelids mo, magkapantay pa ba o drooping yung isa? Assess. Diba? Kaya lang, pag tingin mo sa salamin, meron namang mga salbahe na neighbor ko minsan, ang patugtog early morning, ang pangit-pangit mo, ang pangit-pangit mo. Hoy! Tigilan nyo yan. No, I don't have a neighbor like that. My neighbors are always busy with their jobs. Okay, 19 na tayo, han? Closed head injury. Edi increased ICP ang implication niyan. Letter A, that's normal. Very good nga eh. Anong perfect point? 15. Nag-increase siya from 10 to 14. Aba, good prognosis yan. Nag-constrict nga yung pupils niya eh. Good sign yan, reactive. Yung BP niya, tingnan nyo yung pulse pressure, 140 minus 60, 80. Ano ba ang normal na pulse pressure? 30 to 40. Uy, nag-worsen ang ICP, increased ICP niya. Yung 90 to 68, okay pa rin yung 68 normal resting pulse rate. So, boom. The answer is letter C, Cavite. Kanina, Cagayan. Ngayon, Cavite. Okay? Worsening ito. Widening of pulse pressure. Sinabi sa lecture sa inyo, widening of pulse pressure. Hindi mo yung makikita na ganun mismo. Makikita mo application. So you should catch the rewarding or application of the concept. Di ba? Kaya nga matibay ang top rankers kasi talagang imi-mentor namin kayo, di ba? And alam nyo, I would just like to share, magmula no nag-start ang top rank, nandoon na ako. Kasama na ako ni Sir V, no? At hindi ako lumalaya sa top rank. Through the years, yan. Kahit pabalik-balik ako sa Amerika, twice a year, uuwian ko yan talaga. Kasi loyal top ranker din ako. Kasi I'm treated with kindness and compassion. Madali lang naman akong ma-please. Kuminsan nga, sabi, Mama, anong gusto mong merienda? Banana Q, yung bagong luto. Nagkukumahog silang maghanap ng malinis na banana Q. Alam nila, mahina ang GI ko, no? When people value you, you stick with them. Ganun yun. Kasi si Ma'am Udan, may pagkasupladita din eh. Naku, hindi ako Trinity 12, hindi na sila makakaulit sa akin. Yan. Pero ang top rank, hindi ako umaalis. Hindi dahil gwapo si Sir V, no? Well, actually, isa na yun. Joke lang. Okay, pedophilia ka mamudan. Hindi kaya. Okay, they treat me well. And they show that I am valued in top rank. Kaya I'm here with you. Sige na. Number 20 tayo. 20. Hindi yan 20. Alam nyo, ang pronunciation yan, 20. Yon. Magmula ngayon ha, level up na kayo pati pronunciation kasi magiging RN ka na eh. 'Di ba? Kailan finesse na finesse. Okay. Mamudan ang arte natin. Yeah. Okay. Ngayon, spinal cord injury. Basta spinal cord injury na, a very dangerous potential complication is autonomic hyperreflexia. Okay, spinal trauma, spinal surgery, think about the danger of autonomic hyperreflexia or autonomic dysreflexia. So, what is the most common cause of autonomic hyperreflexia? Bladder distension. Pwede rin fecal impaction. Pwede rin pressure sore below the area of injury. Okay? Ano ba ang most dangerous manifestation of autonomic hyperreflexia? The hypertensive crisis that may lead to CVA. Kaya may mga spinal cord injury patients na nasi-CVA kasi nag-fail yung nurse na matandaan na baka pwedeng mag-autonomic hyperreflexia tong pasyente na to. Kaya hindi nakaligtaan nila na i-monitor ano ba yung urine output nito, kailan ba yung huling bowel movement na to. Ganon ang maging expert nurse. Hindi lang, you will not just be there as a warm body para mag-vital signs. Kailan naintindihan mo ang ganap sa pasyente? Spinal cord injury, ay sabi ni Ma'am Udan, I will monitor kailan yung, ano yung, kung may urine output siya, kailan yung huling bowel movement niya, i-check ko nga kung may pressure sore siya. Yan. Do you get me, guys? And you will be very successful. So, letter A, Alabang. Ano ba bang ibang probinsya sa Philippines sa letter A? Agusan. Alayo naman. Ano. Pero nakarating na ako halos sa lahat ng provinces. Hindi ko lang talaga narating Sulu. Kasi yung mga tao sa Zamboanga, sabi sa akin, ma'am, sila na lang pumunta dito. Silang papuntahin mo. Huwag kang pumunta sa Sulu. Sige, okay lang. Time to stop and reflect. Ano na ang score ko? Naka 20 items. Pero halos matapos niya ang isang chapter ng libro niya sa MedSurg. Ganun yon, no? Huwag mag-daydream. Reflect. What am I doing well? What aspect do I need to improve with? Ganon. Okay? Success isn't just about what you accomplish in your life. It's about what you inspire others to do. As you're inspired by different mentors, you should also be an inspiration to others in the future. Diba? Okay. Ano na tayo? Endocrine. Endocrine disorders. Natapos na tayo sa cancer. Natapos na tayo sa neurologic disorders. Endocrine naman. Okay? Daming chapters na, no, nak? 21. DM1. DM1. We did the MS drills. Kaya nga, anak, yung cluster of MS drills that we did, thousands of questions ang mako-cover niyan. Huwag niyong itatapon. Ha? Keep it. All right. Understanding health teachings. Itong I love summer, I can walk barefooted in the beach. Bakit mali? Barefooted. Do not go barefooted. Because usually the feet have diminished sensation, yung peripheral neuropathy, and they may have trauma in the feet without noticing it. Ano ang magiging consequence ng trauma sa feet? It may lead to gangrene. Ay, nako, amputation tayo niyan. Cotton socks with my sandals. Yes, cotton socks will protect the feet from trauma. It will absorb perspiration. Sweet goodies, baka yung blood sugar natin. Sarap, no? Yung sweet goodies, halayang ube. Punta ako ng Bulacan, naku, dumaan ako dun sa, anong tawag nung store nila, yung mga inipit, etc. Anyway, wag na yan. I'm so happy I can go on diet and I will not eat before my sister's wedding. No, hindi pwedeng irregular meals magkakaroon ng hypoglycemia. Pwede bang kumain ng cake? Yes, pero one thin slice lang. At pag kumain ka ng cake, may sugar yan, you have to exchange it with the others. Huwag kang kumain na ng cake, tapos bibing ka pa, tapos ang dami pang pansit. Ala, exchange yan. Okay? Now, letter bayambang. Number 22. Cushing's disease. Ano na nga ang concepts ni Ma'am Udan for Cushing's disease, which is hypersecretion of adrenal cortex hormones. Everything is high except potassium, calcium, and pulse rate. Everything is high except potassium, calcium, and pulse rate. Okay? Now, what to report immediately? Alin ba dyan ang delikado? Irregular apical pulse. Para irregular pulse din yan. Irregular pulse. Why? Remember that there is hypokalemia. Everything is high except potassium. Hypokalemia is characterized by dysrhythmia o rewarding irregular apical pulse. Ganda ng kanilang rewarding. Pero kaya na ninyo yan ngayon. 23, synthroid. So, ano ang side effect? Synthroid is a thyroid hormone. What should be avoided? Because they will affect the iodine levels. Alam nyo, ano yung mga goitrogens? Yung mga goitrogens, those are the fruits and vegetables in the uplands. Kunwari, Baguio. Yun. Yun yung usually storytelling ko for people to remember. Ano ba yung mga bawal pag naka-thyroid hormone? Yung mga mababa ang iodine content. Because there are products in the uplands. Remember, the higher the place is, the farther it is from the sea, the lower is the iodine content. Kaya, yung mga galing sa Baguio, ayan, strawberries, cabbage, spinach, cauliflower, yun, avoided. Anong number yun? 1, 3, 5, and 6. Yun tatandaan nyo. Sabi ni Ma'am Udan, basta thyroid hormones, avoid goitrogens. And these are products in the uplands because they have low iodine content. O pwede rin, tandaan mo kung marunong ka magluto, yung mga ingredients sa chop suey in general. Pero kung hindi ka naman nakasintroid, healthy, kumain ng chop suey. Nakuha nyo, anak? Ha? Maliwanag yun, ha? O, ito yung mga goitrogens. Yan. Ay, kale, I love it in the salad. Ayan, ha? Ano yung Brussels sprouts na yan? Alam nyo, parang maliliit siya na maliliit siya na cabbage. Oo, pero ang sarap niyan. O, pati kasaba. Ha? Hindi ko alam niya. Yung millet ay yan, it's a type of grain. Ayan, soybeans. Ay, hindi ka rin pwedeng kumain ng taho. Diba? At saka ng tokwa. Kasi goitrogen yun. O, see? Okay. 24. Addisons. Ano ang Udan concept ng addisons? Everything is low except potassium, calcium, and pulse rate. Low, hindi pwedeng hyperglycemia. Hyperpigmented of skin? Yes. The second concept is dark skin. Kasi when the adrenal cortex hormones are low, anterior pituitary gland will come to the rescue. It will secrete ACTH. Kaso, hindi lang ACTH ang nasisecrete. Sumasama si MSH, melanocyte stimulating hormone. Kaya may dark skin. Low, BP, yes. Slow pulse rate, no. It's except pulse rate. Purple rate, no. That is Cushing's. Truncal obesity, that is Cushing's. Kaya ang tama lang dito ay 2 and 3. Now, you realize the value of Udan concepts. Pwede. You could deal with a lot of questions in the PNLE with those concepts. Hindi lang sa med-surg, even sa ibang subjects. Okay. Number 25, Cushing's. Di ba? Meron silang obesity, di low calorie. Lahat naman low calorie. What did I tell you? When you have clusters of data, kailan go vertical. Puro low calorie. So, wala kang ma-delete dito. Sabi niya, Cushing's, everything is high except potassium. Mababa ang potassium. Kaya dapat high potassium. Low potassium yan, out siya. Ngayon, glucocorticoid breaks down fats and protein into glucose. So, nabre-breakdown masyado yung protein. Kaya dapat high protein. Aldosterone retains sodium and water. Hindi pwede yung high sodium na yan. May obesity. Hindi rin pwede yung high calorie na yan. So, boom, it's letter B. You're very certain that your answer is correct. Yan yun. Okay? High potassium, dagdagan nyo high potassium, pero low sodium. Yun. Okay. Now, let's have number 26. Lantus. Ano ba ang lantus? It is a long-acting insulin. Long-acting siya. Kapamilya siya ng mga humulin U. Yung mga ganon. Okay, can be mixed? No. Ano ang pwedeng i-mix na insulin? Yung short-acting at intermediate-acting. Like humulin R and humulin N. Yung humulin N, NPH, ganun. Or humulin R, regular. Kaya 1 out ka. Yes. Number 2, no. Anong sinabi ko? Number 2 is a true statement, include. Number 3, true statement, include. Number 4, no. Yung peak niya, hindi nga determined pero yung kanyang duration, pwede. Subcutaneous, natural, insulin yan. Clear in appearance, yes. Ito tandaan nyo. Long-acting insulin are usually cloudy in appearance. Pero ang lantus ay long-acting pero clear. Kaya wag lang kayong magdidepend, clear ba o cloudy? Kasi lantus is long-acting pero clear siya. So the answer is letter C. 2, 3, 5, and 6. Cavite, Cagayan. Yan. Okay. Now, let's go to ito yung lantus. Yan pinagkabalahan kong para makita nyo na ay long-acting pero clear siya. Yun. The millions of Filipinos are diabetics. Diba? 27, IDDM. Preparation of insulin. He places an opened insulin vial inside the refrigerator. Needs further teaching. Negative stem. We are looking for a false statement as the correct answer. Kasi it's a negative stem. Letter A is true. Letter B is false. Do not shake. Roll gently between the palms because if you form bubbles, puro bubbles ang ma-aspirate mo, nag-underdose ka. Una, sa insulin vial before aspirating through removes bubbles before injecting the medication through, kaya ito yung false. It's letter B. Bagyo uli. Okay. Next, 28. DKA. Ano ang characteristic manifestation ng DKA? Highly elevated blood sugar. Highest priority, uunahin mo, may qualifier. Infuse 0.9% sodium chloride, 1 liter at 250 cc per hour. Bakit? In DKA, there is severe polyuria. The patient may become dehydrated with excessive loss of potassium. When yung pee a lot, you lose potassium a lot, ito na naman si cardio. Kaya uunahin mo yung hydration. The rest could be done later. Do you follow? Yes, hydration first. Okay? Now, next, number 29. Dawn's phenomenon. Ano yung Dawn's phenomenon? Ganito yan. During sleep, or during nighttime, I should say, normal yung blood sugar niya. Pero, pagdating ng 12 midnight to 3 a.m., merong increased release of growth hormone. Kahit you are beyond 21 years old, may secretion pa rin tayo ng growth hormone. Kaya lang, hindi ka natatangkad. Ang females hanggang 18 lang, ang males hanggang 21. Pero anong effect ng growth hormone na yan beyond those age? May elevate the blood glucose, kaya umagang-umaga pa lang, 6 to 8 a.m., may hyperglycemia na siya. Kaya tandaan nyo sa gabi, normal blood glucose niya, pero sa umaga, may hyperglycemia. Yun. Kaya ano ang ginagawa dyan to prevent Dawn's phenomenon? Binibigyan sila ng insulin at 10 p.m. Kaya huwag kayong ma-surprise. Tama ba yung doktor na yun? Insulin 10 p.m. Oy, tama siya. He is preventing Dawn's phenomenon. Kasi yung humulin N or NPH, ang kanyang peak of action ay 6 to 8 hours. Kaya pag binigay mo yan ng 10 p.m., tatama siya to control the blood glucose at 6 to 8 a.m. So, ang ganda-ganda ng nursing. Kung maintindihan mo lahat ng ganap sa pasyente, kaya pala may insulin siya at 10 p.m. to prevent Dawn's phenomenon kasi pwedeng tumaas ang blood sugar niya ng 6 to 8 a.m. Pag ang patient mo o relatives nagtanong, Miss, bakit may insulin siya na? Explain mo yung sinabi ni Ma'am Udan. Alam mo, if you give explanations that satisfy patients or family, they would love you as a nurse. Palagi ka nilang hahanapin. I have experienced that kasi by nature si Ma'am Udan, mahilig makipag-usap sa pasyente and relatives. Tokis-tokis talaga. Kaya na-appreciate tayo. Psychosocial care kasi yan hindi lang marites. Hindi lang marites-marites yan. Talagang when people understand what's going on with them, they feel so happy and they're very appreciative of you. Yan. Kaya pag madi-discharge on ang patient, naku, palagi silang may thank you card o kaya may konting flower o kaya minsan may pa-cake para sa unit. Pag may nagbigay sa iyo na pasyente, huwag mong iuwi. Ano ka ba? I-share mo sa unit. Sige, mag-uwi ka dyan. Don't be stingy. Yan. Letter C ka, anak. Let's go to Number 30, constipation. Ay, ma'am, bakit po hindi increase fluid intake? O, konting kalma, explain ni Ma'am Udan, bakit pag may hypothyroid, fiber ang sagot? Sinabi ko na sa inyo, do not memorize answers to questions in the PNLE. Depende kasi yan sa situation. Ano ba ang other name of hypothyroidism? Mixed edema. So, ibig sabihin nun, yung may hypothyroidism, may edema. Kaya hindi siya patient-centered or appropriate mag-increase fluid intake. So, hindi lahat ng constipation ay fluid intake ang mauna mong sagot. Depende sa sitwasyon. Si hypothyroid may mixed edema. Kaya ang letter A, no. Kaya anong susunod? Fiber. See? That's critical thinking, anak. Pag tagpo-tagpuin mo yung mga napag-aralan mo into whole, integrate, isang tao lang ito eh. Huwag mong pira-pirasuhin. Yung puso niya, iba yung kanyang brain, iba yung kanyang lungs. Hindi. Ito ay isang tao na may brain, may pancreas, may kidneys. Pagtatagpuin mo yan. Kaya yan ang framework ng PNLE. Kailangan matuto kayong mag-alaga sa isang buong tao. Hindi pira-piraso na organ lang. Di ba? Ganun yon. Huwag kayong mag-alala. Through the years, magiging expert kayo. Hindi naman sinabi ni Benner, hindi naman advanced beginner, expert na. Hindi. You go through. Diba? From novice, NACPE. I usually use the mnemonic NACPE. Novice, advanced beginner, and on. Competent, proficient, bago maging expert. Yun. Okay. Number 31 tayo. Hyperthyroidism. Ano yung Udan concept sa hyperthyroidism? Everything is high, fast, and wet. Eye manifestations. Hypocalcemia. Okay? Diba? Kaya, ang perfect combination ay letter A. Alabang. Bakit? If you go vertical, itong letter B, tama. Itong letter C, tama. Itong letter D, tama. Pero pumunta ka dito sa pangalawa, obesity, wala na yan. Kasi they are thin. Dry, warm plus dry skin. Dry, hypo yan. Diba? Tapos brittle pa. Constipation. Hindi yan fast GI. Yan ay slow. Usually may diarrhea sila. Kaya the only correct combination is letter A. Alabang. Okay. 32 tayo. Adrenal insufficiency. Ano bang adrenal insufficiency? Addison's disease. Anong kulong nila? Steroids. How do you know that a medication is a steroid? Ang suffix ay zone. Prednisone, hydrocortisone. Yung mga ganun. So, it should be a steroid. Very good. Punta tayo sa number 33. NPH. Pag unrefrigerated ang vial, hanggang kailan potent? 1 month. Pero alam nyo, sa Philippines, I would not agree with that anymore. Pero theoretically lang yan. Kasi, hindi dapat outside the refrigerator, lalo na kung summer. Kasi yung heat index natin, ano ba yung mga heat index sa Cagayan, sa Nueva Ecija, dito sa Metro Manila? Di ba? Above 40. So, I would not place that insulin vial. Kaya lang, kung sa exam, kung wala sa refrigerator, hanggang kailan potent yan? 1 month. Kaya palagi, lalagyan, when you open a vial, lagyan mo ng date and time. Ganun yun. Okay? Kasi kahit ang expiration niya 2024, pero na-open na, ay, 1 month na lang yan. Next. Ay, sandali lang ha. Okay, number 34 tayo, anak. Oh, initial action. I know there are many commercially combined insulin. Kaya lang, hindi naman lahat ng places sa bansa natin may mga ganong mabibili. Magko-combine pa rin si nurse. Kaya ang una mong gagawin, inject air into the cloud insulin but withdraw the clear insulin first. Bakit ganun, ma'am? O ganito. Teka, may drawing yata akong, share. Ang likot naman ni Ma'am Udan. Bakit may lumabas na naman ganun? Ayan. Buti na lang tinutulungan ako na magbumaba yun. Teka, yung aking arrow. Ay, wala. O ganito, explain ko. Wala yung picture ko. Okay. Dalawa yung vial mo. Isang cloudy insulin, isang clear insulin. Yung cloudy NPH. Yung clear, yun yung regular. Bakit unahin mo to inject air dito sa cloud insulin but do not aspirate? Para may positive pressure na siya. Kasi ang gagawin mo next, inject air and aspirate. I-aspirate mo na yung clear insulin. Yung vial, yung syringe mo, may clear insulin. Hindi ka na pwedeng mag-inject air dito, kundi baka ma-sport mo yung ano. Kaya all you have to do now is to aspirate. Kasi may air na ito kanina eh. Di ba? Basta, inject air into the cloud insulin but withdraw the clear insulin first. Yun, anak. Ha? Okay. Next, 35. Total thyroidectomy. Most important. Why? The most dangerous potential complication of thyroid surgery is thyroid crisis because of probable spillage of thyroid hormone into the circulation. Eh di, sobrang taas ang TPR-BP. And the patient may die because of thyroid crisis. Kaya importante, monitor pulse and temperature. Or, make it simple. Ano bang una mong minomonitor? Eh di vital signs. Yun yung kasimplihan. Pero specific to thyroidectomy, the most dangerous potential complication is thyroid crisis, which may be fatal if it is not assessed and managed in a timely manner. Yun, anak. Ha? O, dalawa na yung rationale noon. Yung pangalawa, repeat to the master level, vital signs first. Yun. O 36, thyroid storm. Sinabi ko na yan, lahat increased. Kaya, lahat increase ay letter B. Itong letter A may decrease. Yung letter C may decrease. Tapos letter D may decrease. Eh sabi ni Ma'am Udan, basta thyroid crisis nga eh, all the vital signs will be elevated and may be fatal if not managed in a timely manner. O, di ba? Ang galing ng ating discussion, parang kwentuhan, pero matatandaan nyo. Okay? Keep calm and imagine your future. Ay, ang dami kong dapat memorize, ang dami kong dapat tandaan. Ito naman si Ma'am Udan, nagbigay pa ng normal values, dumagdag tuloy sa akin may memorize. Kailangan mo yan, anak. Gusto mong kumita ng kalahating milyon sa isang buwan, someday? Hindi naman kaagad yan eh. You have to equip your knowledge with yourselves with adequate knowledge, skills, and positive attitude. It's climbing the ladder. Hindi yung lumipad, doon ka kaagad sa summit ng isang bundok. Hindi pwede yon. Ang alam ko lang na tao na nabuhay, na nakalipad, si Saint Joseph of Cupertino. May I share with you? Hanapin nyo yung prayer ni Saint Joseph of Cupertino. Kasi that is the prayer for success in exams. Idagdag nyo sa mga devotional ninyo. Ay, sorry ha, pag Catholic. Uh, yung hindi Catholic, I am not trying to evangelize. Okay? You pray in the manner that you were taught in your own religion. Okay? Sorry lang ha. I respect all religions. In fact, I even worked in Kingdom of Saudi Arabia nung araw as an exchange professor sa King Abdulaziz University. Alam nyo, ang laki-laki-laki-laking university nun. Ganda. Oo. So, kaya nga pag nurse ka, there are so many fields that you could go to and then enjoy the experiences to the most. Ako, as an educator, talagang in-experience ko lahat ng mga yon. Basta maganda. You'll never be brave if you don't get hurt. You'll never learn if you don't make mistakes. You'll never be successful if you don't encounter failure. O wag naman sa board exam. Do you get me? Maring nag-fail ka sa practice test, and then it was rationalized by the equally brilliant instructors of top rank. Kaya pagdating ng actual PNLE, ang tibay mo anak. You are so strong. You're so resilient. You are so confident. Okay? Now, sige pa. Wait, hinahanap ko yung aking laser. Ayun. Cardiovascular and blood disorders tayo. Pero alam nyo, mapuputol ito. And it is very important topic. Kaya, with your permission, Sir Ron, magpapa-break ako before dealing with another major topic. Okay lang ba yon? Sir Ron? Ay, niwan ako.
Yes po, ma'am.
Sino yan? Si
Ma'am
Fel?
Marge po.
Ay,
Si Ma'am Marge
Marge!
po. Hi, Mami.
I
Hello
miss
po.
you, anak ko. Ay, I heard your voice. I'm
po.
so happy for you. May baby ka na?
Opo. Yes po. Yes po, meron na po isa po.
Ano, girl, boy? Oh, I missed you. Tingnan nyo, love na love ako ng mga tao sa buong top rank. Kaya I memorized them. Nag-pandemic na lahat. Boses pa lang nila. Love ko na. Sige, break muna tayo kasi cardiovascular, mapuputol ito eh. Ha? Pwede na?
Yes po. Yes po. Thank you po.
Thank you. Asan yung merienda ko?
Papag na lang po.
Virtually.
Nakakamiss po yung trip natin dito sa Baguio, Doc.
I know. I miss yung binibili ninyo na Magnum. Ano na nga, yung parang ganon, drumstick.
Yes
Ay,
po, yung ice cream po na.
Oo.
Tapos yung cake po,
Tagka 20
strawberry
pesos.
cake, good taste.
At saka yung, boy bawang.
Ay, opo, yung request nyo po.
Sige, kalimutan nyo ako. Break na muna tayo.
Hindi po, sige po.
Hindi, nangungotong naman si Mama Dan. Joke lang. Tsaka yung Skyplex ko.
Ay, opo. Tsaka po yung special request niyo po sa Starbucks na coffee.
At sige, break na tayo. Okay, nurses, break is over. Let's resume. Okay, we are now in situation 4, care of patients with cardiovascular and blood disorders. As I have said early on, still the number one killer of Filipinos are cardiovascular and blood disorders, especially cardiovascular. Well, most of these are lifestyle diseases. Pero kasi, ang lifestyle natin, happy lifestyle. Kaya lang, nakakamatay, di ba? Sarap kumain ng lechon, ng sisig, ng chicharon. Lahat masarap, okay? But of course, something in moderation. Huwag kumain ng 1 kilong lechon ng isang upuan lang, no? Bahala ka kung yan ang gusto mo. 37. Guys, are you with me? Are we now in the same channel? All right. To be included in the nursing care plan of a patient with MI, number 1, yes. Number 2, yes. Number 3, yes. That is the baby aspirin dose, which serves as antiplatelet. It does not serve to relieve pain because for aspirin to relieve pain, it has to be 500 milligrams and above. But this one is antiplatelet. It will prevent blood clot formation. And number 4, yes. Number 5, yes. Is training at stool uses Valsalva maneuver that increases cardiac workload. Bedside commode, yes, not bedpan. Because when the patient lifts the hips, when you serve the bedpan, that is using Valsalva maneuver. Valsalva maneuver is very bad for patients with MI. Kaya nga, the patient is given stool softener like Senocot. Kasi it has been found that MI patients who are in the hospital may be found dead in the bathroom, and the usual cause is straining at stool. So the answer is letter A, alabang. All of the above. 38, guys. Okay. Severe MI, left-sided CHF. Left-sided CHF, Udan concepts. 1, left lungs. 2, cellular hypoxia. 3, RAS, manifested by hypertension and hypokalemia. That's it. That's all that you need to memorize. Huh? Now you will value the Udan concepts. Ilalagay mo talaga yan sa index card para days before your PNLE, you can access them. At madali mo lang i-shuffle-shuffle. Or pwede kang bumili ng ganito, yung mga small papers na may color-color. Aba, investment mo yan. Ako, mahilig akong ng colored, ISTI. Ayan, isang Udan concept, another page, isang Udan concept, ganun. If you get organized, ang buhay mo organized, anak. I tell you. Okay? Now, cannot climb flight of stairs without getting short of breath. Di ano yan? Left lungs. Sleeps with head elevated or top niya, left lungs. Crackles, left lung. And then school, oh my God, skin cool, shortcut. Skin cool and diaphoretic, di ano yan? Ito ay skin cool and diaphoretic, di hypoxia. Cyanotic, di hypoxia. Enlarged liver and spleen, no way, that is systemic. Peripheral edema, no way, that is venous backup. So 1, 2, 3, and 4. See, it gets easier, anak. Bright future talaga. It's letter D, dagupan. Okay, 39, intermittent claudication. That is characteristic of arterial insufficiency. Hindi pwedeng elevate kasi arterial legs down. Oh, see? The concepts nandun pa rin. Kala nyo, ganun lang ang concept. Pero you can use them. You can utilize them. Okay? Warm compress? No. Because you may release any blood clot there. Magka-pulmonary embolism ka. Ha? Progressive exercise. Yes, progressive muna. Elastic bandage? That is for venous. Ang pinag-uusapan natin, intermittent, therefore arterial. You see that now, anak, ha? It's letter C. Number 40, captopril. Pril. Okay. So, captopril may cause hyperkalemia. Yung insomnia, parang ano na rin lang yan, mga lateral side effect. Pero it's more on hyperkalemia. Yung mga pril drugs na yan, ha? Captopril, enalapril, lisinopril, basta may pril, they may cause hyperkalemia. Kaya pag tinanong ka, collateral question, pag tinanong ka, which of the following antihypertensive medications is not recommended for a patient with renal failure, tumingin ka na may pril, because they may cause hyperkalemia. It's bad for patients with renal failure. Okay? We go to number 41, left-sided. Diet. If the client says that food item to avoid is, sinabi ko sa inyo, basta cardiac patient, avoid Valsalva maneuver like straining at stool. Trinanslate nila sa prutas. Trinanslate nila sa fruit. Alin ba dyan nakaka-constipate? Boom, banana. Make sense, di ba? Ang tatalino talaga ng mga board of nursing. Pero kayang-kaya ng top rankers, tapatan yung talino nila. Kung ano ka ha, Valsalva maneuver, avoid constipation. Boom, ang constipation related sa banana. Kaya nga anak, when you pass the PNLE, feel na feel mo, critical thinker ka. You are very smart. Diba? It will enhance your self-esteem. If your self-esteem is enhanced, palaging glowing ang itsura mo. Mukha kang fetus. Diba? Hindi lang yan. Halos fetus na. Happy ang outlook mo. Come on, let's enhance your self-esteem. Let's get that license. Ibang-iba ang feeling mo. Hindi ka magyayabang, pero yung deep inside you, you are proud of yourself. You appreciate yourself. Kasi syempre hindi tayo nagbrabrag, di ba? Humility. Pero makikita nila yung glow sa mukha. Pag sinabi nila sa'yo, oy boy, oy girl, ang handsome mo o ang pretty mo. Yun pala ang nagagawa ng RN license. Di ba? You will inspire other people. Sige na nga, ako din, sige, nawalan na ako ng pag-asa niyan. 12 years ago pa ako kumuha. Sige na, kasi possible pala. Sabihin mo mag-top rank. Ha? Kasama si Ma'am Udan doon. Kamo, di ba? Number 42, CPR. Pag naka-recover, to the side. Side lying. Yes. Predict the answer. Yun yung ginamit mo dyan. 43. Alin ang factors primarily primarily associated to peripheral arterial disease, cigarette smoking and hypertension. Number 1 yang dalawang yan. Pag yung mga peripheral arterial disease, cigarette smoking and hypertension, more than the others. Kaya alam nyo, ang pathophysiology ni Mamudan sa cigarette smoking, death. Ganun lang, kasimple. Alam niyo naman si Mamudan, simple-simple, pati mga libro niya. Bakit ko ba iisa-isay na magkaroon ka ng peripheral vascular disorder, magkaroon ka ng COPD, magka-MI ka, ay naku, isa-usapan lang yan. Cigarette smoking, death. Galit na galit yung mga nag-smoke yan. Pag nag-i-smoke ka, anak, tumigil ka na. Talaga. Sige, bahala ka. If that is good for your sanity, pang de-stress mo, there's so many ways to maintain your sanity and to de-stress yourselves rather than cigarette smoking. Di ba? Ikaw, choice mo yan. Ako kasi, never in my life na nag-smoke ako. I don't want to fill my body with nicotine. Di ba? Yung si Kadiri nga eh. At thanks God, may allergy ako sa alcohol. Kasi siguro kung hindi ako allergy sa alcohol sa Amerika, pag party, naku, di inom-inom dyan. O di na DUI sana ako, driving under influence. May allergy ako, kaya yung non-alcoholic beverage lang, yung may kulay-kulay din. Kunwari lang, you know, I'm one of the groups na inom-inom lang, pero actually non-alcoholic yun. Pretending lang naman si Ma'am Udan. Tapos lalagyan ko pa yan ng cranberry juice. Di mukha siyang red wine. Arte-artehan lang talaga. Letter C, si Cavite uli. Kapitbahay ko ang Cavite. Kasi where am I at? Nasa Las Piñas ako. Yan. Marami akong friends yan sa Cavite. 44, triple A. Bakit sudden severe back pain? That indicates rupture. Pag severe back pain lang, parang expected because the ballooning or bulging aortic aneurysm compress spinal nerves. Pero kung may term na sudden, anak, that implies rupture. That will concern me most. That is characterized by massive internal hemorrhage which may be fatal. Fatal yan, anak. Okay? So it's letter B. Let's go to number 45, DVT. Anong problema sa deep vein thrombosis? Blood clot. So, you know what? Yung number 1 rule na sinabi ko sa inyo, answer the question. Ano ba ang root cause? Doon mo atakihin. Thrombophlebitis, blood clot yan. Kaya, boom, anticoagulant versus the others. Anticoagulant, blood clot yan eh. Basta, kasi nga, tayong Filipinos, we don't usually answer the question. Kaya pati sa PNLE, medyo hirap. Kaya ngayon, I have primed your critical thinking with regards to this. Ma-apply nyo na yan. O kunwari, sa Amerika, sabi ni Amerikano, sa isang Pilipina, will you marry me? Ang Amerikano, yes or no lang yan. Pag Pilipina, you know what? I have brothers and sisters who are in school. I have to send Zoom.com or Western Union. Naku, wala silang pakialam dyan. Yes or no lang. Diba? Okay, ganun din yan. Blood clot ang problema. Di anticoagulant ang primary intervention. Ito yung DVT, anak. Bakit you are having pain in the leg? Baka may blood clot ka dyan. Kaya nga, do not vigorously massage the legs. Yung iba sa inyo, ang hilig magpamassage ng hard massage. Sus, Ginoo. Ako noon, meron akong pinupuntahan kasi na massage parlor sa Amerika na ang taga-massage, mga Chinese, tsaka Vietnamese, ang galing nila. Pero pagdating sa legs, talagang soft lang sila. Pero ayoko din talaga ng hard massage. Para kang binugbog after. Soft lang. Tapos nag-i-slumber ako, nagigising ako sa sarili kong snoring. Kaya wag na wag ninyong, kung minsan sa inyo, may mga pamangkin kayo, dadapa kayo, sasabihin nyo, oy, boy, tapak-tapakan mo ang legs ni Tito, ha? Kasi pagod ako. Naku, huwag niyong pinapagawa yan. You never know kung may blood clot ka, this will be released, may pulmonary embolism ka. Nakatulog ka, hindi ka na nagising, nag-pulmonary embolism ka. Do you get me? Kaya galaw-galaw din para wag pumanaw. Number 46 tayo. Atorvastatin. Number 1, yes. Okay. Number 2, yes. They may be hepatotoxic. Number 3, yes. Because if you lose fats, go with the fats will be the fat-soluble vitamins. ADEK, ADEK. Muscle tenderness, yes, because one of the side effects of statins is rhabdomyolysis, characterized by muscle weakness and tenderness. Okay? Kaya nga, the statins are to be given after dinner, not during daytime. Because if muscle weakness occurs during daytime, there will be falls. Sino ba usually ang naka-statin? Di mga elderly, di ba? Tapos may sila, degenerative changes sa muscle sila. They might be falling. Okay? Avoid grapefruit or grapefruit juice. Ang katumbas niyan dito sa Pilipinas ay yung parang pomelo. Bakit? Grapefruit or grapefruit juice may inhibit absorption of atorvastatin. Kaya pag naka-statin si lolo, lola, si mami, daddy nyo, wag masyadong kumain ng suha kasi may epekto yun eh. Okay, so all of the above. Galing, no? So alam niyo, yung mga choices na binibigay ni Ma'am Udan yan, they could be good sources of information. Kasi I use principles of test construction for critical thinking. 47. Not a, ano ba yun? Safe, not safe. Okay, not safe. All right. Kaya, recap needles. We do not recap. You might be poking yourselves. Magkaroon ka ng needle stick. Do not recap. Bakit lahat kayo ganyan? Paano yung ganyan? Anong tawag dyan? Yung may muka-muka ng bear, tapos gumagalaw-galaw kayo. How do I do that? Oo, ako, I readily learn technology. Ito yung safety needle. Ngayon, kung medyo kulang sa budget ang ating institution, pwede maging resourceful. Alam niyo yung mga plastic cans ng biscuits, kagaya ng Skyflakes, kagaya ng Fita, yung mga ganon, yung mga browas, pwede nyong gamitin kasi it serves the same purpose. Okay? Plastic din kasi yun eh, butasan nyo. O kaya, yung yung gallon ng bottled water, pwede. Ay, ang Pilipino pa resourceful, no? To prevent needle stick and prevent transmission of blood-carrier disease like hepatitis B, HIV, AIDS. 48, prone to risk to HIV. It's all about transmission sa blood. More on multiple body piercing like tattooing. Yun. O sige, bala kayo. Gusto nyo mag-tattoo. Alam nyo ba? During our generation, ang may tattoo, mga ex-convicts galing sa preso. Pero ngayon, lalo na sa Amerika, naku, mga women, kahit may edad na, may tattoo-tattoo. Baala kayo. Ayan, mga multiple body piercing. Dami-dami niyang mga earrings. Tapos ito, tattooing yan. So, you are not certain that the needle used is sterile. Sterile pala dito. Sterile. Kaya, well, number 49, use of anti-embolic stockings. I will wear the stockings before getting out of bed in the morning para wala pa siyang postural edema and will promote venous return. Okay? Yan lang yung tama dyan. And then let's go to number 15. Coumadin. It's anticoagulant. What is the antidote of Coumadin again? Vitamin K. Translated ngayon sa vegetables. Which vegetables are rich in vitamin K? Ito yung green leafy. Ayan siya. Lettuce. Hindi yan lettuce. Hoy, lettuce yan. Lettuce, spinach, and other green vegetables. They are rich in vitamin K and will antagonize Coumadin. Tingnan nyo ha, ang ganda-ganda ng PNLE. Kanina yung constipation, i-translate na banana. Yung vitamin K, i-translate na green leafy vegetables. Ganyan sa PNLE. You don't expect na yung actual words na ginamit sa lecture, yun din ang makikita nyo. And avoid the blaming culture. Yung sinasabing, wala naman sa ni-review. Yung lumabas sa exam, meron, ikaw lang hindi naka-recognize kasi you forget rewarding. Pero now that you are mentored on that, alam mo na. Alam mo na. So, pabaon yan, anak, ha? Pwedeng ma-reward. Yun. Okay, let's go to number 51. O nursing care plan. O cardiac cath to prevent bleeding and to prevent circulatory impairment, affected leg immobile, extended for few hours. Kailangan immobile. Naku, pag nag-ooze yung blood, yung femoral artery, I tell you, nakakatakot, grabing ang lakas ng bleeding. Ha? May nangyari kasi noon, ako yung clinical nurse specialist kasi sa cardiac telemetry. May patient kami na Vietnamese. Papunta pa lang yung anak to make sundo kasi madi-discharge. Aligaga. Naku, sinabi na namin huwag tatayo. Tumayo, naku, grabe yung oozing ng blood. Nakakatakot. But of course, the son did not blame us kasi alam na nila that the father usually overestimates his ability. Yun lang. Kasi doon nakakalungkot, wala silang masyadong relatives na magbantay. Kaya maswerte tayo sa kultura natin. Palagi, di ba, ang dami nga. Kung minsan, papagalitan pa tayo kasi ang dami-dami. Merong natulog sa tabi ng pasyente, meron pa sa ilalim ng kama, meron pa sa couch, lahat na lang. No? Ang observation ko sa Philippines, ang maraming relatives usually. Wag nang magalit kasi ako din naman ganun yung aking lahi. Yung mga taga Batangas, clannish talaga yung mga yan, no? Yung mga Ilocano, Diyos ko, nakakagaya ni mama. Tsaka yung mga Kapampangan, kagaya ng father ko, Diyos ko, talagang clannish. At makikipag-away pa pag limit visitors, di ba? Ganun talaga, mapagmahal. Okay? Number 52 tayo. Ay, teka muna. Sabi, kailan ng encouraging words. Sige. Don't allow negative circumstances to destroy you. Learn from your experiences and surround yourself with people who will lift you up and show you the road to success. Alam nyo, may mga kaibigan kayo na ganyan. Mga precious jewels. Kaya pag ang kaibigan mo panira, review ka, halika na pre, inom tayo. Naku, ilaglag mo yan, hindi mo siya kaibigan, ipapahamak ka niya kasi gusto niya, kasi miserable ng buhay niya, ang buhay mo. Pero pag yung, friend, aral tayo, mamaya na tayo mag-chat ulit ha, after 2 hours. Pag nag-chat, mga 15 minutes. Kasi kailangan mo din ng kausap, kahit sa text-text lang. Pero kung minsan sa oras ka nag-text, 15 minutes, lang ikaw nag-aral. Chat kayo ng chat ng 2 hours, tapos nasa same page ka pa rin. Naku, ha? Gusto mo ng 500,000 per month someday? Mag-aral. Mag-aral. Hindi ako nag-i-exage. Talagang regular RN pa yun na masipag. Yung 3 days lang kasi ang regular na work sa Amerika. May 4 na araw kang extra. Anong gagawin mo sa 4 na araw na yun? Yung 2, ipahinga mo. Pero yung 2, i-overtime mo na para marami kang ipadala sa Pilipinas. Okay, action is the fundamental key to success. Kumilos ka. You know what? Hindi pwedeng tulog ka ng tulog tapos panaginipan mo lang lahat yung sagot sa exam. Saka pa. Action. Umupo ka. Buksan mo ang books. Mag-aral ka. Sumagot ka ng practice tests. Diba? May nag-message kanina sa akin, Ma'am, I'm using your book. Thank you. You're helping me sponsor some Aita children in Zambales pag tinutulungan nyo yung aking libro. Salamat. Okay. Pero hindi ako nagtitinda online dito, ha? Nagpapasalamat lang. Oh, situation 5, GI na tayo, nurses. Wow, nakalahati na yung book ni Mama Dan. GI na. Oh, ano naman ganap dito? Chemotherapy. Ano ang hindi dapat? Among cancer patients, meat tastes bitter. Ma'am, bakit? Kasi the cancer cells affect the appetite center sa hypothalamus. Kaya yung meat nagiging mapait. Oo. Kaya ang meat dyan ay beef. O ngayon anak, pag sinabi, nilagay dyan, kunwari, chicken tinola, pork adobo, Mamudan, di mo tinuro yun. Tinuro ko, meat tastes bitter. Ngayon anak, kung di mo alam na ang chicken o pork ay meat, ang laking problema mo. Ang laki-laki ng problema mo. Pero alam ko, wala kang ganong malaking problema. Ha? Mama Dan, you're very naughty. You're silly. Oo nga. Okay, 53. Dumping syndrome. Alam nyo, dumping syndrome is caused by rapid emptying of gastric content. Kaya anything that will cause rapid content, bawal. Rapid emptying of gastric content. Kaya, should be included. Yung number 1, no, dapat lying. Okay, so number 2, yes. Bakit high protein? Protein will empty the stomach slowly. How long will be the transit of protein in your stomach? 3 to 4 hours. Low carbohydrates, because carbohydrates can empty the stomach rapidly. 1 to 2 hours lang, gutom ka na. Okay, and then number 4, after. Yes, not during meals. And then small frequent feedings, yes, because you have to prevent gastric distension and prevent rapid emptying. Limit salt, yes, because salt will increase osmolarity of the gastric content and will pull the plasma from intestinal capillaries. Kaya, hindi, dapat 2, I'm sorry, mali yung highlight ko. 2, 3, 4, 5, 6. It should be letter B. It is letter B, Baguio. Okay? Sorry sa pag-highlight ko sa letter A, tao lang. Let's go to number 54. Full liquid. Okay. So naka-full liquid diet na siya, bibigyan siya ng solid foods. Anong gagawin mo? Assess ability to chew. Ay, ma'am, bakit hindi po presence vowel sounds? Kasi naka-full liquid siya, kaya kailan ba siya binigyan ng full liquid? May vowel sounds na. May vowel sounds na. Bakit ngayon magsusolid vowel sounds pa rin? Yan. Namitoprolol ka na naman. Now you know. Oo nga, no? Meron na siyang, vowel sounds, kaya nga siya nag-full liquid na eh. Ngayon, kung solid food, di ability to chew na. Di ba? Kunwari, elderly ito, di ba? Nakakanguya ba? Kaya bibigyan nyo sila ng soft foods, malambot. O kaya, kunwari yung chicken, isred mo na yung chicken, isred mo na yung pork. Yung mga vegetables, alam ko, magandang tignan yung luto na buo ang okra, alalaking chunks ng kalabasa, magandang tignan. Pero pag elderly, smaller sizes na. Do you get me? Pati yung sitaw, dati ganyan kakahaba. Hatiin mo na ng maliliit. Pag may elderly sa bahay. Ia-adjust nyo talaga. Dati, crunchy-crunchy talaga yung vegetables sa chop suey. Ang gagawin mo, habang crunchy-crunchy pa, maghiwalay ka na for majority of the family. Pero mag-iwan ka ng konti na softer, yung sayote, yung carrots, yung beans, para sa elderly na kasama nyo sa bahay. I-practice nyo ang nursing primarily sa bahay. Yes? Basta ability to chew yan, dagupan. 55, cancer. Ito yun, yung masarap. High fat, high calorie, diet. Yan yung number 1 na risk factor to cancer as found by researchers of American Cancer Society. Tayo pa namang Pilipino, yan yung ano natin, pagkain, no? Sisig Kapampangan, ang sarap, may kalamansi. Yung mga high calorie, puro tayo kakanin, lahat ng kakanin, lahat ng cakes. Sarap, no? Okay. Nalala ko yung cake sa contest tsaka sa karamiya. Ay. Alright. Mamada, nakakagutom ka. Alright, 56. Gastroesophageal reflux. Kailangan by gravity, head of bed, elevated. O kaya sit up. It's letter B. Puro yan, elevated. Okay. Now, number 57. Anong meron yung pasyente? TPN. Bakit, ma'am, hindi I will check my urine for ketones? Kasi, ano ba ang primary, ang primary rationale for TPN? Di nutrition. So, ang uunahin mo about nutrition. Wag na muna yung side effects. Ano ka ba? Ganon yung mindset na standardized. Anong problema ko? DBT, blood clot. Alin ang pang blood clot? Anticoagulant. Ganon. TPN for nutrition. Ano ang most accurate indicator of nutritional status? Di wait. Kaya, yung iba, i-check mo, pero hindi sila. Yung number 1, sabi ni Mamudan, answer the question. Tanong ko, sagutin mo. Yes? Simple lang yon. Ito yung tanong, ito yung sagot. Mahirap bang tandaan yon? Hindi. Kaya lang, nasana yung ating brain. But now, I am trying to mentor you. Alam nyo ba, kung ano daw yung naririnig natin, ano yung sinasabi sa atin, that will form our brain. Kaya pag you are listening to people about critical thinking, yun, na-educate daw yung brain, na-develop yung brain mo towards that. Kaya nga, you have to choose your friends. Kaya pag ang friend mo, ang usapan palagi, inuman, or recreational drugs, o pamamasyal, nang wala namang katuturan, di yun talaga na-form sa brain mo. Di ba kagaya ng advertisement, panay ang advertisement ng ganito, mamaya tingnan mo, bumibili ka nun. Ha? Kaya, choose people from whom you could get wisdom. Yung mga practical aspects in life. Kagaya ng may mga kaibigan ka na, matuturuan ka na, paano ba magtipid? Paano ba mag-invest? Paano ba magkaroon ng passive income on top of your meager salary? Di ba sa una, meager, konti lang talaga. Pero, pag yung mga nakakausap mong tao, mababait, puro positivities, ganun daw madidevelop yung brain mo. Promise. Pero pag ang kausap mo palagi, marites about lives of other people, mga pangungutya, panlalait sa ibang tao, ganun na rin yung brain mo. Kaya yan, nutrition, di wait muna anak, now you know. Number 58, orophycal route. Shigellosis, that is dysentery. Dysentery, pagtatae. Kaya fecal-oral route. Letter A. Predict the answer ginamit mo. 59. ID is like Trendelenburg birds to prevent air embolism. To prevent air embolism. Predict the answer. Remember, in the cluster of MS drills, I gave you the most commonly asked positions. Nandun yon. Huwag nyo tatapon yun. Ilagay nyo sa folder. Souvenir nyo yan. Sa mentoring ni Ma'am Udan. Number 60. Evisceration. Diyos ko po, katakot yan. Ito yung descent is gaping of the wound. Pero yung evisceration, there is protrusion. Makikita mo pa yung peristalsis. So, how do you deal with this? Do not jump and panic and run. You have to cover, asan na ba ako? Cover the wound with sterile dressing, moisten with normal saline. Bakit moisten? To prevent necrosis. Magni-necrosis ito o di laking problema. Ha? Okay. Now, let's go to number 61. Irritable bowel syndrome. Alam nyo kung minsan, merong mga questions sa PNLE na parang hindi mo inaasahan, biglang sumusulpot. O di, alam natin, irritable bowel syndrome. Okay, number 1, yes. Number 2, yes. Number 3, yes. Number 4, yes. Number 5, yes. Kasi yung iba, irritable bowel syndrome diarrhea, irritable bowel syndrome constipation, meron ding irritable bowel combination. May ganon. And then, of course, number 6. Yes. Alam nyo, palaging masakit ang tiyan nila. It's either palagi silang constipated or may diarrhea. Pero, diagnostic test usually do not support the manifestations. Kaya kailangan maganda ang rapport ng patient at ng doktor para hindi aakalain na, you are just making up the signs and symptoms. Ang hirap kaya niyan. Okay? So letter D. Now let's go or another. Sabi nyo, words of wisdom. Nothing can subtract hard work from success. Only add to it. Kaya palagi sabi, hard work plus success. Hindi pwedeng success minus hard work. Oh, you must be joking. Hard work leads to success. Yes. Wala pang nagsabi na, nagtap nga ako sa board, di nga ako nag-aral. Niyayabangan ka lang nun. Tapos, gusto niya mapahamak ka. Hindi tama. Okay? Ako talaga, I will admit, lahat talaga, kahit 25 item quiz, I really study a lot. Kasi naisip ko, kawawa naman ang parents ko, nagsasakripisyo sila para paaral ako sa Manila. Kasi I'm from Zambales. Nung araw, wala namang nursing school sa Zambales. So, Manila talaga. Tapos sabi ng tatay ko, anak, doon ka mag-aral sa school na may mga santo sa ibabaw ng building. Sabi, ano kayang university yun? Yung pala sa UST yun. Yun ang pinangarap ng tatay ko talaga na may anak siyang makapag-aral sa school na may building na may mga santo sa ibabaw. Yung pala, grabe, nung kami estudyante, ang baha lampas tao. But not anymore. But not anymore. Sige. Lahat ng hirap dinanas sa nursing. Pero it's worth it, anak. Okay. Situation 6 na tayo. Wow. Respiratory. Nakailam na tayo na chapter. Ayan. Okay. CT scan. Di warm flushing sensation uli. Basta may contrast medium, yan ang asahan. You have to tell the patient that. Kasi kung hindi mo sabihin, and the patient feels it, na very anxious yung pasyente. Kaya tuloy, nag-difficulty breathing, not because of allergy, but because of anxiety. Kailangan tanggalin natin yung bias na yon, ha? Number 63. Edi, fremitus, stress, 999, gadon. Palm of the hands. Sige nga po, magsabi kayo ng stress, 999. May question sa assessment kasi health assessment and physical examination is a 3-unit subject sa panahon nyo. Kasi yan yung mga feedback namin nung araw sa mga ADPCN. Ano ang weaknesses ng Philippine graduate compared with graduates in other Asian countries? Assessment. Mahina tayo sa assessment. Gagaling nila. At saka skills, ang gagaling nila. Kasi ang curriculum nila talaga is skill-based. Pero pagdating sa discussion, research presentation, strong tayo. Pero kailangan i-balance natin. Maging strong din tayo kung saan sila strong. Di ba? Kaya maraming states na dominated ng Filipinos ang nursing, nagiging CNO o, di ba, chief nurses, clinical managers, clinical educators. Kasi kailangan mag-aral ka, continuous ang learning mo. May it be seminars, conferences, graduate studies, kung gusto mong umangat sa rank. Pero kung gusto mo, staff ka, from 21 years old hanggang 65 years old, di sige, wag ka mag-aral. Pero kung ako sa inyo, gusto ko naman, pag medyo 35 ka, masakit na sa likod kaya ang bedside. O, di administration ka naman. Di ba anak? Okay, 64. Normal. Teka muna. Bakit dalawa? Asan yung drawing ko? Okay, ilang battle system sinabi ko? Yung continuous gentle bubbling the water seal, hindi yan normal. Continuous gentle bubbling in the suction control bottle, normal yan. Pero sa Pilipinas bottle system, intermittent bubbling in the water seal. Pag yung floor evac, wala kasing bubbling. Pero kung syempre, ginagamit hanggang sa far-flung areas, bottle system. Kaya yung letter B at letter C for the Philippine Nurses Licensure Exam, both are correct. Pero kung international exam, ito lang ang tama. Kaya hinighlight ko yung dalawa. Okay? So ito yung 1 battle system, 2 battle system, 3 battle system. Tinatanong pa rin yan. Kasi alam niyo na, meron pa rin. Ito yung modern, floor evac. Ito yung mga drainage systems, water seal, suction control chamber. Okay? Pero I predict, ang tatanungin ito, yung battle system pa rin. Kasi sino bang nasa board? Di mga kagaya kong baby boomers, di ba? Okay. Now, in chest tubes, the purpose is to re-establish the negative pressure in the lungs and promote re-expansion of the lungs. It works on 3 mechanisms. Drainage by gravity. That's why the bottles will be 2 to 3 feet below level of the chest. Number 2 is negative pressure or suction. And number 3 is displacement principle. So as the drainage goes to the drainage bottle, the air from the bottle should be expelled. That's why there should be an air vent. In 1 bottle system, what to remember? Immerse the tip of the tube in 2 to 3 cm of sterile NS to create water seal and prevent atmospheric air from entering the pleural space. Because if that happens, the more that the lung will collapse. Wala kayong makikita sa Google Images niyan kasi ginawa ko itong mga templates na to. Nagpaturo ako sa isang graphic artist. Matagal ko kayong ginawan kasi yung tube na yan, pinagtagpo-tagpo ko lang yan. Kaya lang, ito, hindi ko maibaba, mawawala sa plate. Should be at least 2 to 3 feet below level of the chest. Ano ang ganap? There is fluctuation of fluid. Teka, kasama yung laser pen ko. There is fluctuation of fluid along the tube. As the patient inhales, the fluid moves up. When the patient exhales, the fluid moves down. That's when bubbling occurs during exhalation. Kaya intermittent bubbling. Fluctuation of fluid along the tube indicates that the apparatus is patent. Alam nyo, hindi ko magawa. Hindi ko mapamove itong bubbles. Nilalaro ko Kaya lang baka hindi supported ng computer ko yung moving of bubbles. Diba, ang ganda-ganda sana yung heart may nagaganon Alam ko you are tech savvy. Ako naman hindi naman masyadong tech savvy, but I can buy the technology. O ano kayo, ano kayo. O di ba? Pag sinabi, Mamudan, hindi ganyan yan, dapat ganun. Oh, at my age, I can buy technology. Kayo, you are very good with technology. May pambili ba kayo lahat ng technology? Wala kaya? O, di ba? Mamudan. Oo, malaro ako sa technology. O, yung watch ko, tsaka yung aking cellphone, magkakumplunta yan. O, di ba? Hindi. Recommended kasi ng doktor ang ganitong klase ng watch pag medyo 6 and above kasi nakikita namin yung BP, heart rate, autosat, tsaka na-EECG. Yan, di ba? Alam ko, mas mahal yung relo nyo. Oy, tunay yan ha, hindi yan yung Android ha. Okay, next. Huwag ka mag-alala na kung wala ka niyan, pag RN ka na, naku, kahit 10 niyan, at lahat ng kulay ng bracelet, bilyan mo. Ako meron, pag damit ko, powder blue din. Pag purple, purple. Kaya nyo nang umarte naman, ang millennial. Do not call me senior. Para magandang pakinggan, millennial. O, di ba? Kung millennials kayo, ako, millennial. Arte-arte ka Mamudan. O, sige, pag 2 battle system, yung first battle is Jordan's battle, yung second battle is water seal. And I told you, basta water seal, may intermittent bubbling, there is fluctuation of fluid, and you have to immerse the tip of tube in 2 to 3 cm of water to expel the air from the bottle. There should be an air vent which should be kept open. Okay, yan. Ngayon, 65 tayo. Undergone tonsillectomy. Number 1, yes. Number 2, that's bleeding, yes. Number 3, no. Aspirin will cause bleeding. Number 4, no more. Bawal na yan. Luma na yan na pag tonsillectomy ice cream because the milk in the ice cream will make the saliva viscous and the patient needs to clear the throat. Pag gumanon, tumalsik yung blood clot doon. Di bleeding ka. Number 5, yes, so that you could assess bleeding. And number 6, because there are some swallowed blood. Kaya 1, 2, 5, and 6. Okay. 66. What will concern you? Nako, bronchoscopy, NPO 6 to 8 hours. May nom ng glass of orange juice. An hour ago, lagot ka. Baka ma-aspirate. You have to tell the physician. That should concern you. False statement, A. Number 67. Ano ang mali? Intervene. You have to correct it. The sensor is placed on the little finger. You could not accurately measure autosat in the little finger. It's letter B. Let's go to 68. Anong meron dyan? Apply petrolatum jelly dressing at the side to prevent entry of atmospheric air. Okay, good. Now let's have number 69. Pulse oximetry. Number 1, yes. Number 2, yes. Number 3, P for pulse oximetry, A for arterial, correct. And then number 4, yes. Kasi nail polish can inhibit, can cause accurate reading. Number 6, nahuli ka dyan. Number 5, nahuli ka dyan. Ang autosat ay 95 to 100. Yang 80 to 100, yan yung partial arterial oxygen. Iba yun. Nahuli ka dyan. Familiar yung 80 to 100. Boom. Number 6, yes. Kaya letter C, Caloocan, 1, 2, 3, 4, and 6. Hindi kasama ang number 5. Kaya you have to read carefully. Yun yung number 1 strategy na sinabi ko sa inyo. Alright, number 70. Basta yung inflation of cough, ito yung number na tingnan nyo, 20 to 25. Because if it is super inflated, it will cause pressure in the throat and will cause necrosis doon. Can you imagine may necrosis ka dyan sa trachea mo? Okay? Number 71. Ano yung dry mouth and thick saliva? Xerostomia. Kasi yung mga nagra-radiation sa upper parts of the body. Sa mouth, sa thyroid, yan. Xerostomia. Oh, predicting the answer yan. O another food for thought. Success is a journey, not a destination. Journey, talagang you will travel toward success. Hindi yung jumping ka. Dito ka, nasa top rank ka, Amerika ka agad. Unless US citizen ka. Pero kahit US citizen ka, mag-start ka ng application ng job. Mag-start ka ng job. Diba? Ganun yun. Oh, life isn't about finding yourself. Life is about creating yourself. Create the best version of yourself. Oh, nung araw, sa Zambales, nung bata ako, safe pa naman kasi ang mga streets. Kaya, naku, isang kalye yan. Magkakamag-anak kami, magpipinsan kami. Laro-laro lang kami sa kalye, no? Patintero, yung luksong tinik, kung ano-anong nilalaro namin, no? May tangga-tangga pa ng ng kasoy at ng rubber band. Ako, yung rubber band na yan, hustler ako. Ang kapal-kapal ng rubber band ko. Tapos minsan, hindi ako matawag ni mama na mag-lunch alas 12. Sabi niya sa akin, tatagtarin ko lahat yung lastiko na yan at ipapakuluan ko at iinumin mo yung pinakuluan ng tubig na rubber. Takot na takot ako kay mama. Akala ko papainom niya, gagawin niya talaga yon. So sabi ko, basta someday I will be successful para hindi ba ako sinasabihan na tatadarin mo yung mga rubber band at papakuluan at ipapainom mo sa akin yung pinagkuluan ng tubig. So, ayun, nag-aaral ako mabuti. O man, di mo na ako papakuluan ng tinadtad na rubber band. Tawa ng tawa si mama. Sabi niya, kasi kung hindi kita gaganunin, ang hirap mong tawagin. Tumitigas ang ulo mo. Sige, okay lang. Situation 7 na tayo, anak. Genitourinary disorders. Di ba nasisira ang momentum natin sa paglalaro pag tawag ng tawag ang mama? Di ba? Kakasira ng momentum. Okay, nananalo na eh. Okay, Mamadan, para kang pasaway ka ng bata. Hindi, mabait ako. Kaya lang pag yung naglalaro at nananalo ako, naiinis ako, in-interrupt ako. Ganon din ako sa pag-aaral. Wag mo akong ini-interrupt. All right. Number 72. Ano ba ang gamit ng exchange resin oxalate? Di ba? For hyperkalemia. Paano yon? Si exchange resin oxalate may sodium. May sodium yan. May available form given per mouth. Meron ding per enema. Huwag kang magkakamali ha. Baka wrong route. Pero GI din niya naman. Kaya lang sama naman ng lasa yung per enema. No? Loko-loko kang bata ka. Naalala ko tuloy, yung yung tablet na yon, Flagyl tablet. Diyos ko, nagra-rounds ako sa aking telemetry unit as a clinical nurse specialist. Ang ingay-ingay ng African-American patient. What the heck? Gaganon. I hate that pill. It hurts my throat. Ala, ano kaya? Sabi ko sa nurse, may I help you? It seems that you're having trouble with the patient. Binulok ang ganun. Oh, she's telling me that this pill tablet kasi sa kanila pill. This pill is hurting the throat. Pagtingin ko, aba, yung malaking Flagyl tablet per vagina. Per vagina. Yung maliit kasi, yun yung per orem. Kaya, naku, inaltak ko yung nurse. You know what? She will really complain of hurting, of the hurt in the throat because that is a vaginal tablet. Diyos ko, sabi ko, ilan na kaya sa mga nurses na to nagbigay ng oral, yung supposed to be vaginal tablet kasi meron siyang vaginal thrush. O kaya pala hindi gumagaling yung kanyang vaginal thrush, ino-oral. Do you think the manufacturers will manufacture a huge tablet para mahirapan kang lumunok? Kaya ano yan meron siyang sodium. Binigay mo GI, either per orem or per rectum. Ngayon, ano ang ganap? Once the exchange resin kayaksalate reaches the colon, ito siya. Si sodium will detach from the kayaksalate. Alam nyo naman yung relationship ni sodium at potassium. Magkaaway yan. Parehong positive. Okay? Ngayon, sasabihin ni potassium, ay, nandito yung aking mimesis. I will attach to the resin kayaksalate. Kaya yun, sodium ion in exchange for potassium. Hindi potassium sodium kasi sodium ang nandito. Nag-detach, kaya sodium ion in exchange sa potassium. Paano niya mariresolve ang hyperkalemia? Paglabas ni exchange resin kayaksalate sa GI, sa feces, nasama si potassium. Yun yung istorya doon. Ngayon, nag-isip ka, kung may renal failure, pwede ba ang exchange resin kayaksalate? May sodium? Pwede. Kasi, gamitin lang natin si sodium para umalis si potassium. Pero, hindi siya matutuwa ng matagal. Kasi ito si renal failure, may Lasix. Kaya si sodium, ginamit lang natin pampaalis kay potassium. Pero later on, aalisin din siya ni Lasix. Parang yung mga males makakarelate. Parang yung may movie tungkol sa syndicate. Di ba? Kukuha ka ng hitman. Si sodium, pinatay niya si potassium. Namatay si potassium. Do you think the syndicate will give the promised reward kay sodium? Hindi, papatayin din siya. Alis ka din, sodium, through Lasix. Ay, tama ba yung aking analogy? Basta yung mga males, naintindihan ako. Yung mga females, bala kayo, hindi nyo maintindihan yun. Basta sodium ion in exchange for primarily potassium. 73. Basta may end-stage renal failure, decreased secretion of erythropoietin, kaya anemia. Kaya nga 'di ba, may renal failure na una halos weekly ang blood transfusion. Tapos 2 to 3 times a week. Tapos meron pang point na every day, every single day, they have to go through blood transfusion. Basta may end-stage renal failure, anemia ang isa sa main problem. Ganun lang anak. 74. Para saan yung CAPD? The patient is taught or trained on how to do it at home, or maybe a significant other who is available to do it for the patient. Yun. Okay. Ganito yun, yung continuous ambulatory peritoneal dialysis. It's very convenient. Kaya lang, ang taas ng degree of infection, kaya hindi na masyadong ginagawa. Kahit nag-work ka, sige, infusion time, 20 minutes. Yung equilibration time, yung mananatili yung dialysis sa abdomen mo, 30 minutes. After 30 minutes, turn on mo yung drainage. Ayan, mag-drain siya. So 10, 20, 30 minutes. So, yung bag na yan, pwede mong empty later na. Kaya, busy siya. He can still go to work. Kaya nga lang, mahal ang dialysis solution at high risk for infection. Kaya, usually, hemodialysis na. 75, testicular cancer, undescended testis. Undescended ang testis at birth. Yun. Kaya nga, if the child has been born with undescended testis, kahit pa na-repair yan surgically, he will be taught to do TSE, testicular self-examination from age 15, teenager yan. Pwedeng i-reward yan na high school. Tama, 15, high school. Okay? Kasi the highest incidence of testicular cancer is between 15 to 40 years old. Males. When do you do? Monthly, wag nightly. paluin ko kayo dyan, anong nightly. Mga loko to mga to. Okay, monthly testicular self-examination is after a warm shower. Bakit after a warm shower? The scrotum is relaxed and you could palpate the testes more adequately. Basta ganun. Okay, number 76. Oliguric phase. E di may water retention yan. Fluid volume excess. Very good. Okay, let's have number 77. Nasaan ba ang kidneys? Pyelonephritis, kidneys. Nasa likod. And you call that area between T12 to L5 as costovertebral region. Basta kidneys, ang tawag mo yung location ay term na costovertebral region. Nakuha nyo anak? Ha? Yes. O, dami nating takeaways after, ha? O, ito yung costovertebral region T12 to L5. But the right kidney is slightly lower than the left because of the presence of liver on the right side. Okay, 78 tayo. Ileal conduit. The patient that it is normal observation. Kasi if the patient has bladder cancer, they will harvest a small length of the ileum, yung last part ng small intestine. Ang gagawin, i-close tong side na to, and the other side will be sutured over the abdomen. Okay? Parang ang itsura parang colostomy rin. And then, after removal of the bladder with cancer, the ureters are connected to the ileal segment. Ina-interrupt ang circulation ng ileal segment. Kaya magkakaroon niya ng mucus shredding. Kaya normal yun. Okay? So yan yung ileal conduit. Okay? Ay, sorry. Now, 79. Pag siya ay urinary incontinence, Kegels. Alam niyo nang gawin yan as if you are controlling your voiding na walang toilet. Tapos, bumpy ang road, nasa bus ka, ang lakas-lakas ng aircon. O contract the pubococcygeal muscles at the count of 10, relax. Contract the pubococcygeal muscles at the count of 10, relax. To be effective daw, you have to do that 36 times a day. Ganon. Okay, number 80, peritoneal dialysis. Major disadvantage, letter D. High glucose concentration of the dialysis necessary for ultrafiltration causes carbohydrate and lipid abnormalities. Nag-hyperglycemia siya. Okay, so it's dagupan. Okay, number 81. Ano ang complication? Ang pinag-usapan, complication, oliguria. It is oliguria, rewarding of renal insufficiency. Okay, complication of BPH, renal insufficiency, rewarding oliguria. Walang polyuria, yung bleeding at fever, there are manifestations. Okay. Next. Next, food for thought. Marami akong papabaon sa inyo to form your brain towards success. Success is the sum of small efforts repeated day in and day out. Nasabi ko na yan sa inyo, araw-araw na ginawa ng Diyos. From now on, mag-aral, mag-practice tests. Tsaka na yung ibang mga pasyal-pasyal na yan. Do you get me? Ha? Hindi mo naman gagawin ito sa buong buhay mo. Hanggang, kailan ba exam nyo? Uy, kailan ang date na exam nyo? Ma'am Marge, anong date na exam? May kausap ba ako? Nasaan yung chat?
Hello po, ma'am.
Kailan ang exam?
Sa May 28 tsaka 29 po.
Oh, I am asking the exact dates kasi para naman special intentions ko kahit online mass ako, pero kung Sunday yon, yung Sunday makapunta ako sa church, and then I light a candle, may small grotto kasi ako dito sa bahay. Then, special prayers ko yun para sa inyong lahat. We may belong to different religions, pero kahit kanino ka magdasal sa akala mo na sa puso mo siya ang Diyos mo, then papakinggan yan for everybody. Ha? O, situation 8 na tayo. Diyos ko, ang daming chapters na. Hepatobiliary and pancreatic disorders. I usually focus on the focus of the PNLE. Okay? O, bakit siya may swelling of the abdomen, ascites yan. Portal hypertension and hypoalbuminemia cause a fluid shift into the peritoneal space. Yung bakit may hypoalbuminemia? The liver is unable to metabolize nutrients including protein. Di ba si albumin taga-hold ng plasma sa loob ng blood vessel? Walang albumin. Nag-shift out yung plasma. Naiipon sa abdominal cavity which you call as ascites. Hindi yan ascites, that is ascites. 83, hepatitis A. Pag hepatitis A, kailangan low-fat diet. Obvious ba, ito mga to high-fat. Kaya ito lang yung low-fat. Why low-fat, ma'am? Because fat is the most difficult nutrient to be metabolized. Pahingahin mo naman si liver mo. Alam mo ba, habang kain ka ng fatty foods, si liver ang nag-overwork para sa iyo. Tapos, dadagdagan mo pa ng alcohol. Si liver ulit ang overwork. O di ba? Magka-combine kasi yung, ewan ko bakit nga ganun ang pulutan. Kailan fatty, alcohol, tapos fatty ang pulutan. Hindi ko alam rationale no. Okay, kasi nga sabi ko sa inyo hindi ako pwede uminom ng kahit na red wine lang. Wala, hindi kaya. Mag-allergy ako. Nasubukan ko na yun. Red wine, 1 jigger. Naku, umalsa yung mukha ko, pati tenga ko, laki-laki. Red na red. Tapos di ako makahinga. Diyos ko, mamatay-matay na. Hirap. Kaya nga pag may uminom, lakas-lakas uminom, alam nyo, inggit match talaga ako. Bakit di sila nagre-react? No? Pero kung minsan, yung pag nalasing na, ang baliw-baliw, tawa ng tawa. Wala naman nakakatawa. Di ba? Number 84, acute pancreatitis, autodigestion of the pancreas. Because the pancreatic enzymes are trapped in the swollen pancreas. Kaya sila, instead na mag-digest ng nutrients, yung pancreas mismo ang nadadigest nila. Trinap mo kami, ikaw ang aming idadigest, sabi nila kay pancreas. Kaya the keyword is autodigestion. Okay? 85. Pancreatitis. Number 1, yes. Teka. Hyper, hindi. Hypo yan. Okay, I'm sorry. Bakit hypocalcemia, ma'am? Kasi yung undigested fats bind with calcium. Kaya si calcium lost in the steatorrhea. Kaya basta acute pancreatitis, the electrolyte imbalance that you will remember, wala nang iba kundi hypocalcemia. Okay? And then number 2, yes. Number 3, yes. Kasi yung fat, providing diet low in, baliktad. Kailangan providing diet low in carbohydrates, dapat mataas yung carbohydrates niya to offset yung kanyang low protein, low fat. Okay? Ngayon, yes, number 4. Bakit number 4? So itong number 1, hindi hypocalcemia yan. Yung number 2, pwede. Number 3, hindi. High in carbohydrate yan. Number 4, bakit respiratory infection? You remember, When the patient has acute pancreatitis and the patient inhales, masakit. Kaya they don't usually take deep breaths. They tend to hold their breath because breathing deeply will cause pain. So yun, respiratory. Morphine, pwede. Ganito ha, may nagsabi sa akin, Ma'am, bakit sa libro mo bawal ang morphine? Anong edition ba yung binabasa mo? Ma'am, 2009. Abay, noong 2009, yun yung tamang knowledge. Sa pancreatitis, cholecystitis, Demerol yes, morphine no. Pero through the years, because of research, na bago yung knowledge. Kaya ngayon, pwede na pareho ang morphine at Demerol. Kaya huwag niyo sasabihin mali ang libro ko. Depende kung kailan yan naisulat. Do you get me? Meron ng 2023 edition. Bakit 2009 pa yung ginagamit mo? Sabi, maminana ko po ito. Ginamit po ito ng sister ko, ng pinsan ko, another pinsan ko. Panlima na po ako. Sabi ko, luging-lugi naman ako sa libro. Ang dami nyo nang pumasa. Hindi pa rin kayo bumili ng bago. O, diba? Joke lang, hindi ako nag-advertise. Marami naman kasi bumibili, kaya I don't need to advertise. At yung aking publisher, carrier din niya ang Shopee. Oo, nakita ko, sabi ko, ay, bakit nagtitinda ang Shopee? Sabi ng publisher, yeah, kailangan maging modern tayo, innovative tayo sa ating mga selling platforms. Kaya pala sabi ko, kaya pala may nag-text sa akin taga Hulo, Ma'am, nakabili ako ng book mo through Shopee. Nagulat ako. Shopee, kulang na lang, pati Lazada. Sabi ko, pero pala, carrier pala. Kasi sila nang bahala sa shipping, di ba? Ganun yun. And then, kaya wag niyo akong sisitay na, Ma'am, mali yung libro mo. Anong edition? Aawayin kita. Okay. Number 6, yes. So 2, 4, 5, 6. Letter B. Oy, dami nating Bagyo. Okay, 86. Lapcole. Ito, reporting any bile-colored drainage or pus from the incision. Alam nyo, maliliit lang naman yung incision. 3 to 4. Ngayon, 3 na nga lang eh. Kaya lang, pag may bile-colored drainage, ay nako, may ano tayo dyan. May spillage tayo, no? Tapos pus, ay nako, na-infect. Aliit na nga lang eh, parang butas lang talaga. Well, I have to admit, last year, I have to go through Lapcole. 20 years ago, alam ko na meron akong stone sa gallbladder. Hindi naman sumasakit. Basta wag ko lang i-trigger ng fatty foods. Pero it came to a point, talagang grabe yung sakit. 1 week na, hindi makuha ng buskupan. Diyos ko Lord. Sabi ko, pandemic, RT-PCR ako. At naku, baka wala pwedeng magbantay sa akin. Dami-daming mga protocol. Pero hindi ko na talaga kaya. Pumunta ako doon sa surgeon na siya yung nakadiscover na may gallstones ako 20 years ago. Ay nako, gawin na natin yan. Puputok na yung gallbladder mo. Ay nako, sabi ko, Diyos ko day. Sabi ko, binutas tiyan ko. Tapos hanggang sa may umbilicus, isang butas. Sabi ko, ay, ang pangit. Anyway, yon, but God is good. I survived. Okay. Ngayon, 87. Ano ba ang lactulose? Well, it's a laxative pag sa GI. Kaso, meron siya cirrhosis. Pag sa liver, associated ang lactulose, ang magiging sagot, black ammonia formation. Ayan na naman si answer the question is specific to the situation. Lactulose acidifies the colon and will prevent formation of alkaline ammonia. Bakit natin kailangang i-block ang ammonia formation sa liver disorder? To prevent hepatic encephalopathy. Yon. It's letter C. Okay? Pag GI ang situation, laxative. Pag liver, black ammonia formation. Kuhan nyo yun, anak, ha? Kala nyo lang, Daming sinabi ni Udan, matatandaan ko ba yun? Matatandaan mo yan. Okay? May input sa memory. O 88, esophageal varices. Anong ganap dito? Sengsteken Blakemore tube. Uy, tinatanong pa rin yan ha. Number 1, yes. Mamaya ko explain sa drawing. Number 2, yes. Number 3, yes. Number 4, yes. And number 5, yes. All of the above yan. Ganito yan. Teka, may drawing dyan eh. Ito si Sengsteken Blakemore tube. When is it inserted? To control bleeding of esophageal varices. Ngayon, what stops the bleeding esophageal balloon? Anong purpose ng gastric balloon? To anchor. To anchor the SB tube para hindi yan ma-displace upwards. Kasi if the gastric balloon is punctured, the esophageal balloon moves up, may airway obstruction tayo. Kaya ang emergency equipment, scissors. Airway is more important. The nurse may cut the tube when respiratory distress is observed. Okay? Airway palagi yan. Ito, rubber sponge near the nurse will anchor the SB tube para hindi ma-displace downwards. Not to protect the nose, to anchor. Tatandaan nyo yon, sinabi ko yon, o 89. Yung lap cole, alam nyo, vagal simulation, referred pain to the shoulders. Yung first 24 hours, naku Diyos ko, ang sakit talaga ng shoulders mo. No? Referred pain to the shoulders. Yon. And then, number 90. Ano yung Whipple surgery? Ito yon. It is done for patients with cancer of the pancreas. Okay? Kaya, head of the pancreas is removed, anastomose to jejunum. And then, si common bile duct tanggal. Kaya, gallbladder to jejunum. And then, distal stomach is removed, connected to jejunum. Kaya there are 3 organs, pati si duodenum tanggal. So there are 3 organs connected to the jejunum. Kaya pancreatogegenostomy, cholecystogegenostomy, gastrojejenostomy. Okay? So it's letter C. Alam nyo, I have encountered several patients in my lifetime as a nurse who had undergone Whipple surgery. The prognosis is very good. Oo, matagal-tagal yung lifespan pa ng pasyente. Pero talaga, the geography of the abdominal organs is greatly disturbed. Kanya ba, yan 3 organs inano dyan. Oo. Yung last na encounter ko, 84-year-old female Vietnamese patient. Naku, 84 years old. Ang ayaw siya i-give up ng mga anak. Talagang Whipple surgery. On discharge, naku, ang lakas niya, panay ang ngiti. Sabi ko, oh my God, 84 years old ito, legendary, no? Okay, choice, not circumstances, determines your success. Anong choice mo? Pumasa, di ba? Kaya, iwasan niyo yung angst na, kaya hindi ako makapag-aral kasi naman si mama, papa, away ng away, ang ingay. Do not blame others. Kung naingayan ka, edi pumunta ka sa library, di ba? Mayroon kang gagawa. O kaya anong tawag doon? Earplug ka. Do not blame others for the consequences in your lives. Ikaw lang yun. Pumasa ka, effort mo yun. Tapos sinuport ka. Pero primarily effort mo yun. 99% is your effort. Yung 1% inspiration mo yun. Diba? Okay. Situation 9 na tayo. Fluid electrolytes. Wow, favorite nyo yan. Pag nitrofurazone, how do you apply dermatologic medication? Thin only. Ano yung thin na yan? 1/16 inch film directly to the burn sites. If it's too thick, it may be systemically absorbed and may cause toxic reaction. Kaya yung mga inilalagay nyo sa mukha ninyo, ewan ko kung inilalagay nyo na mga facial dyan, huwag makapal. Akala mo habang mas makapal, mas makinis, mukha kang fetus. Hindi thin lang yan. Thin lang yan. Oh, di ba? Oh, next. 92. Oh, what parameter will you check when you give IV? Urine output. Because if the urine output is less than 30 ml per hour in an adult, don't you dare give potassium chloride IV drip. Why? May cause renal failure. Oh, ito yung concept. No P. Ano ang P? Ihi. No K. Potassium. Pag hindi adequate ang urine output, don't start with potassium chloride. Else, there will be renal damage. Diba? Okay. Dami na nyong giveaway, ha? Pabaon ko yan sa inyo, anak. 93. Third degree. Eh di, ano na yon? Subcutaneous. Pearly white lesion. Diba? Pearly white. Kasi ang fats ay white. O, ito yung third degree subcutaneous. Pearly white. O, 94. Emergent phase. 1. Sodium and water are trapped in the interstitial space. May hypovolemia, kaya hemoconcentration as evidenced by increased hematocrit. Walang diuresis kasi habang may hypovolemia, may oliguria. And then, since may oliguria, mayroon ding fall of BP. And then, hindi siya hypokalemia. When cells are damaged, they release potassium into the circulation, kaya hyperkalemia with hyponatremia. Oo. Nandyan sa libro ko, tingnan nyo, yung mga ganap sa emergent phase, tapos diuretic phase, recovery phase of burns. At saka nasa lecture din ninyo ng mga equally brilliant instructors. So 1, 2, and 4. Aralin nyo yung burns, ha? Okay? O, 95. Sodium is trapped. Di ba si sodium tsaka si bicarbonate magkaibigan? Eh si sodium nawawala, nasa interstitial space. Kaya sabi ni bicarbonate produced by the kidneys, ay wala yung BFF ko, may I just leave? So ang ibig sabihin nun, when sodium is trapped in the interstitial space, well, bicarb could not be bound. Kaya it will be excreted. So when sodium is unavailable, hyponatremia, then we lose bicarbonate. Kaya metabolic acidosis. Yun. And then, 96, shock. Whatever the shock is, may it be hypovolemic shock, distributive shock, neurogenic, anaphylactic, shock, puro yan inadequate tissue perfusion. Inadequate tissue perfusion. That is the primary pathophysiology. 97. Basta initial response of any form of stress in the body, hemorrhage, shock, dehydration, hypoglycemia, SNS palagi. That is the fight or flight response that will help us survive any form of stress. Kaya hahanapin mo, anak, basta early, sympathetic nervous system yan. And then 98, dehydration, elderly. Huwag mong pipiliin ang poor skin turgor because as I've told you, when a client is 65 years old and above in the general population, there is degree of wrinkling on the skin. Ganun yun. So, 1, 5, and 6. All the rest, ano na lang yan? Hypervolemia yan. Okay, 1, 5, and 6.